The school board work session begins in 1 minute. Please take your seats. Again, the school board work session begins in 1 minute.
Good morning. I now call the June 4th, 2026 Administrative Briefing and Work Session of the Marion County School Board to order at 9 a.m. Please silence your electronic devices to avoid disturbing others. Mirroring and modeling how our students begin each day, I ask that you please pause with us for a moment of silence. Thank you. I will now read our board commitment statement. We are the Marion County School District Leadership Team. When we come together to work, we are efficient, effective, and productive. Our three most important characteristics are dedicated, transparent, and individually responsible. To work well together, we must demonstrate respect, confront reality, and be accountable. We will always put students first. We will leave a legacy of success. I'd like to ask the school board attorney to explain the rules for this public workshop. Good morning, Attorney Powers.
Good morning, and thank you, Madam Chair. This work session is a public meeting as defined in Florida Sunshine Law. The board is dedicated to full transparency in its meetings and its work. In compliance with the Sunshine Law, the board has adopted uniform meeting procedures, including the right for citizens to participate. The board will allow public comment regarding any work session item listed on today's agenda at the appropriate time. Speakers must fill out a request form located in the lobby and hand it to the board clerk. After the board and superintendent have completed their discussion on a particular agenda item, the board clerk will call the speaker's name in the order received. Each speaker will have 3 minutes. As required by the Sunshine Law, the board must maintain orderly conduct and proper decorum throughout the meeting. Speakers may criticize subject matter and decisions in a respectful manner, but not people. Finally, speakers must be very careful not to violate the privacy rights of others, especially students and their family members, by mentioning their names or other identifying information. Thank you for your attention to these important rules.
Thank you, Attorney Powers. Good morning, Ms. Martinez-Young. Can you please provide the proof of publication for today's meeting?
The notice for the June 4th, 2026 Administrative Briefing and Work Session was published on the district website on May 28th, 2026. Proof of notification has been attached to board docs under proof of publication.
Thank you. Good morning, Dr. Brewer.
Good morning.
You will provide our superintendent's briefing?
Yes, ma'am. I have quite a few things to share this morning. I want to start off by just recognizing everything that took place for graduation. So I have some numbers that I would like to share. Corey Taylor provided a great summary, but the two highlights is we had 31,669 guests that were screened for all of our graduations. So our team did an incredible job making sure that the new open gate detection system worked, and all of us were safe during the graduation ceremonies. I want to highlight how many volunteers it took for graduation. We had over 283 volunteer hours. That's 91 volunteers that participated in the open gate detection system. So that's a huge, of course, we'll recognize these individuals internally, but I just want to recognize how many people and hours it took to ensure that all of our graduates and families were safe during the graduation ceremonies. As of yesterday, we had 2,100 students show up to summer school. This number will continue to grow, and we will continue to monitor the enrollment and, of course, the progress that all the students are making during summer school. Something that I just want to remind you all when you are visiting school campuses, that the state's class size recommendation for our intensive intervention for our third graders is 8 to 10 students. So when you're visiting the classrooms and it might look like there's low enrollment, it's important that we keep those classrooms at an incredibly low class size. I want to celebrate a couple things. Our Pheasant Forever Scholarship, and I'm sure some of you will also recognize them later, but thanks to Mr. Bernie Little and the St. Bernard Foundation, the Pheasant students, their lives will be changed because of this scholarship. And so we're incredibly grateful to the St. Bernard Foundation. I still cannot share final numbers for student data as much as I want to, but I'd like to just say, based on preliminary data, we will have more A's and B's this year, and we will not have any D's in our traditional schools. Last year, as you know, we had 5 D's, so we're very happy to report that we will not have any D's in our traditional schools. School grades will be released by July 1st, and that's when we'll be able to give the formal numbers. In the last couple board meetings, work sessions, there's been conversation about the comparison of 2 elementary schools, Winding Oaks Elementary and Ross Prairie. So I just want the community to understand when we have the GMPs for board approval, when we present that information to the board for approval, that is the contractor's price. What we have to do is we have to add back the owner direct purchases to that. So when we look at Winding Oaks Elementary, their final contract, their contract was $37 million, but there were $6.5 million in owner direct purchases, with a total construction for that campus being $43 million. In Ross Prairie, the final contract was $36 million. The owner direct purchases were $4.5 million. And then the total construction expenditure for that campus was $41 million. So I think sometimes it's not very clear when we're approving GMPs because of that's with the contractor. So I just wanted to highlight that number so that was clear. And the final celebration is Dr. Campbell and I have worked closely with our federal lobbyists to work with Congressman Randy Fine's office to secure a federal earmark. And this will be the first for Marion County. And we received the call yesterday that we have made it through another hurdle, and we only have one more step to go in the process. And so it is not the entire dollar amount that we requested, but our name is still there. And so we are moving closer to securing funding. And just for awareness and a reminder, this is for an early learning center in the southeastern portion of Marion County. So we're very excited about that. And as you know, part of our strategic plan, one of our goals is to increase external funding. And this is moving us in the right direction for that goal, or not goal, for that priority. So those are all my comments, Mrs. Conrad.
All right. Thank you, Dr. Brewer. We sure do appreciate a lot of positive things happening around the district. All right, we will move on to item 4.1, self-funded health plan review and 2027 options. Mr. Rios-Welsh. There he is.
Good morning.
Good morning.
I hope everyone is doing well. Dr. Brewer, board members, and members of the audience. So today, we're going to have a presentation on our self-funded health program and some options that as we are continuing our negotiation internally in terms of getting to a balanced budget for the 26-27 school year, we wanted to provide some information and information only to board members. I do want to make sure that I'm crystal clear that we will by no means be providing any recommendations today. This is strictly for informational purposes only, and any official recommendations to the board would have to come through the insurance committee, which is comprised of a cross-section of not only employees but other stakeholders as it relates to our health insurance program. So today we have representatives from Gallagher, who is our third-party administrator, who handles a lot of our actuarial analyses, and Ms. Laura Lingle is going to come up and go through this presentation in detail, and we do appreciate her and her team coming to us today. And we also have another member of her team who she's going to introduce, who's here from out of town, who's also going to walk through some other opportunities, as it were, in terms of cost containment that we are exploring. But again, to emphasize, no recommendations will be made today. This presentation and its backup documents will be provided to the insurance committee, and I will formally request a meeting date to be identified, and we will then run this information through that committee, and then at a subsequent board meeting, hopefully there will be a recommendation to the superintendent and perhaps a vote. But there will be no recommendation, as it were, today. So with that, I'd like to introduce Ms. Lingle. She's going to come up. Thank you.
Good morning. Thank you, Mr. Welsh. Dr. Brewer, Vice Chair Conrad, board members, Attorney Powers, excited to be here again today to present information about the self-funded health plan, in addition to some other items as it pertains to the employee benefit program. So as Mr. Welsh said, myself, I have VIRAC here presenting with me on a program that we would like the district to consider. Danielle Markwell is also here with me today as a support member of the team that helps assist with the board. And then we also have Angela Hooper, who assists, and Sally Donovan is the financial analyst behind many of the numbers that you will see today. So the agenda will review the current plan and the 2027 projections, some cost-saving strategies, health funding analysis. Oh, can you not?
Ms. Lingle, we're having a little bit of trouble hearing you.
Okay, is that better?
Mac, a little bit closer.
A little bit.
There you go.
Okay, perfect. We're going to review the Medicare Advantage plan. We spoke about that earlier in this year, and then just some of the RFPs and audits that will be taking place for 2027. So as we move into the financial analysis, we present a similar comparison year over year, so you can see what the numbers were for 2024, how the plan ended in 2025, what we're looking like for 2026, and then some projections for 2027. So for calendar year 2026, I do have some good news. Again, these are projections based on claims through March. We recently received claims through April, but not in time to have the data analyzed for the information to be put on board docs. But if you remember from last year, we recommended a 7% increase. The numbers were calling for 10. We felt comfortable with 7 and to use about $2 to $3 million in the self-funded health plan. So we do have some good news from what we are seeing in the numbers. We actually anticipate that we will see a gain in the self-funded health plan at the end of 2026 by just over 1 million, 1.5 million, I'm sorry, 1.15 million, whereas we were projecting a loss. That is, we believe, due to a couple of things. One, at the time, we had not solidified the pharmacy benefit manager contract renegotiation for 2026. We anticipate that we will be seeing about 1.5 million in additional rebates as a result of that renegotiation of the contract. The other thing is that when we project, as you remember, stop loss is not negotiated until the fall. So we are projecting, when we give these numbers earlier in the year, we projected an increase at 15%. We were able to negotiate that stop loss contract to just over 1% for the 2026 year. So those two items are helping with our claims fund. And again, we anticipate that we'll be seeing an increase of about 1.15 million. With those numbers, we should end the year with a fund balance of just over $30 million. We are required to have 60 days of claims, plus the incurred but not reported, IBNR. Those are claims that have occurred, but maybe the provider has not submitted them to Florida Blue. Sometimes it's considered a run-out claim number. So with those numbers, calendar year 2026, we are required to have just over $14 million in the fund, and we anticipate an excess then of an additional $15 million ending 2026. As we go into calendar year 2027, you can see what those projections are. Just a couple of things to point out. You will see that the projected board and employee contributions is remaining the same. It is the desire, I understand, of the district and Mr. Welsh to not increase any funding. And this is an aggregate number, so we'll talk about how these numbers are split later on in the presentation. But aggregate with board contributions and employee contributions, we are not projecting any sort of increase. With that staying status quo, we do project just over $8 million in a loss in the self-funded health plan. Again, these are status quo numbers. So if that occurs, we would need just over 13 million with just over 2 million for the IBNR. So at 16 million would be the 60-day requirement. If we lose the 8 million that would be projected based on claims and trend, we would have an additional excess of just over 5 million. So we would be at close to 3 months of reserves. Required to have 60 days, we would be closer to 90 days in that scenario. Some items to point out. So when we've talked about this before, medical trend, pharmacy trend. In the insurance world, it's similar to what we anticipate costs will be for medical and pharmacy in the future. So new medications are coming, new procedures are coming, the cost of doing business in the medical field is increasing. So those are the trend numbers that we use to project the required increases, along with what we are seeing in the district's claims. We talk about maybe shifting some of the costs in the later presentation, but we also recognize we need to do something about managing to claims. And so the next projection includes some our cost containment strategies that we're going to discuss in the next few slides. So you can see the numbers are very similar, except some of the medical and pharmacy claims will be decreasing. That is as a result of some of these programs that we would like to put in place. So with that strategy, we anticipate losing just over 5 million from the claims fund, and you can see the numbers accordingly there. So that would put us just over 3 months of reserves if we implement some of those strategies. I do want to point out a couple of things. The stop loss projections are actually being projected at 25% instead of 15%. Again, we don't believe that that is where the district will be at the end of this year. However, we are seeing some significant increases to stop loss numbers, not only for private sector, but public entities. We have a district that we work with that received a 50% stop loss renewal just recently. And so conservatively, we have changed from projecting 15% to 25%. So those numbers are built into these projections. Our anticipation in our initial data does not indicate that that's where the district will be, but again, conservatively, our actuaries like to put in that number. The other number is 12% is the projection if we do not do any cost containment strategies. We did go to Florida Blue and ask for a fully insured quote. So if we were to go back fully insured instead of remaining self-funded, their projected increase would be about 16%. So we do see that the self-funded plan is working over a fully insured contract. The other thing that that fully insured contract would not include is stop loss, and I say that in quotations. In a fully insured contract, they call it pooling. There would not be a pooling number included, so the district would essentially have all claims hit their claims experience. Right now, we stop at $400,000 per member, and then it moves to stop loss. The fully insured contract that was quoted didn't have that cap on it, so any claim number would hit our claims experience. So again, I think with those numbers, we believe that we're in the right direction with the self-funded health plan. We have a very healthy fund balance reserve, and so in times like this where we do need to use some of those reserves, we have the ability to do that and maintain the funding that we're using right now. Any questions on those numbers?
Board? Okay.
Okay.
Thank you, Ms. Lingle.
Yes, the next slide is the 24-month review of claims. So you can see this month over month over the last 24 months. Subscribers is employees. Members is then the employees and any dependents that they have on the policy. And then you can see medical, capitation, and pharmacy. Those are our claim numbers. So medical, obviously medical claims. Capitation, there are some providers that are paid a flat fee based on the number of employees that they see or number of patients they see every month. So instead of being paid per claim, they're paid that flat number. So medical and capitation are combined in the medical experience, and then you can see our pharmacy claims and total claims. We have some consistencies. You can see over the summer months, we generally spike in claims. In December, we spike in claims. That's fairly common with a school district. That's when employees have the opportunity to have procedures done. December, not only common in the school district, but also in other organizations because people have met their deductibles and out of pocket, so they're having procedures done at the end of the year for those things. So with those numbers, again, we recognize that we need to implement some cost-saving strategies in addition to looking at how we are breaking up the contribution between the board and the employees. So at the beginning of this year, well, the end of last year, Gallagher acquired another organization called Assured Partners. Assured Partners had developed an initiative called Assured Excellence. Essentially, they looked at large organizations like Walmart and Amazon, and they said they can go to providers and direct contract because of the number of employees that they would be bringing for services. While we don't have Amazons and Walmarts, we do have a large employee population across all of our books of business. So the idea was to do the very same thing and go to providers and direct contract with them to be able to save with those claims. And so I'm going to bring Virek up because he has been working with the Assured Excellence program longer than I have. He's going to talk through what this might look like for the district. And again, you can see at the top, we conservatively estimate about $2.5 million in potential savings by implementing a program like this.
Good morning.
Morning.
Excuse me. So as Laurel mentioned, I came through via the Assured the acquisition through the Legacy Assured Partners brokerage. I am the current operator and owner and runner of the Assured Excellence program, and I'll give you a brief background on why it was created and the value that it brings. So the creator of the program created this about 10 years ago. His wife got really sick and they were in the hospital. He works and lives in the health insurance industry. We consider ourselves experts. He had struggled navigating through on getting care for his wife, talking to these providers, thinking about billing and payment. So he said, there's got to be an easier way to do this. And, we were aware of what Walmart did, what Lowe's did, where they went to a Cleveland clinic, or they went to the Johns Hopkins Hospital and direct negotiated a contract for all of their members. They had 1.5 million members. They said, we can negotiate in volume for lower pricing. So what he did was reached out to Johns Hopkins and said, hey, we have 1.5 million in aggregate, and now that we're part of Gallagher, significant amount of volume to direct contract with these providers. So we have hundreds of providers across the country for various procedures. So on the list that you see here, orthopedic procedures, cardiac surgeries, cancer diagnosis, inpatient substance abuse, high-cost medical specialty drugs, and also high-cost infusions. So what we did was we went to these providers and said, we want to develop a case rate or a bundled payment. And what that means is we aggregate all these different services for one fixed price. So under the arrangement that you have today with your plan, if you go, and I'll use the orthopedic procedure as an example. If you go have a total knee replacement, you're paying for the surgeon, you're paying for the anesthesiologist, you're paying for the medication. So when you get your explanation of benefits, you have a line item of all those different pieces. And that can vary from provider to provider. So if you go to Dr. Jones for an orthopedic procedure, it may be $50,000. If you go to Ascension, it may be $70,000. You don't know unless you as a consumer call and ask for the pricing. So we negotiated a fixed price for these providers. So, and it's one fixed payment. So the anesthesiologist, the surgeon is all built into one transparent pricing. So you would be aware of what that cost would be. Your members would be aware of what that cost would be. And what we also included within that one fixed case rate or that bundle payment was a stipend for the member. So if they do have to travel, and we have providers in the state of Florida, if they do have to travel to, let's say, Jacksonville or Orlando, we include a travel stipend to offset that barrier to have to travel. And they can bring a companion with them as well, so a family member, to offset hotel, lodging, food, if they have to hop on a plane to go to the Cleveland Clinic for a cardiac procedure. We incorporate a stipend to offset, again, that financial barrier for them. So the triple aim for this program was quality, high-cost quality for the providers that we negotiate with, transparent costs and pricing, as well as outcomes. So two critical pieces are the quality and outcomes. So when you go have the procedure, you want to make sure there's no complications. So what we also negotiate into these contracts with all these providers is what I call a 30-day guarantee. So let's say something adversely occurs as a result of the procedure, that provider is still responsible for incurring the cost. So you as a plan sponsor don't have to pay extra, whereas under your current arrangement, if I have an infection, something goes wrong, I go back in, incurring more claims on top of the claim that already had occurred. So the intent of this was to remove that barrier and provide a easier lever and level of consumerism for the members, so they don't have to call around to different providers to have, figure out what the cost is for these procedures. Here is transparent. We remove that financial barrier of travel, and the way that the program is designed as well is to remove any copay, co-insurance, and out-of-pocket costs for the member as well. So it's trying to design and derive a truly white glove concierge service for your members. So it removes that pain of who do I have to call and not have to worry about where they get referred to. We have low cost, high quality providers on our list. And it's the program that we have with our clients today is on a voluntary basis. So it's not mandatory. And we match plan rules as well. So if you don't cover a particular service that we have offered in the program, we can obviously carve that out. And if you don't want to offer a benefit that's based in this program, that can be carved out as well. So it's truly a la carte. It's very flexible. The chassis that we built it on makes it very easy for the member when they go through the service, and as well as you as the plan sponsor, because you know what those costs are going to be. So highly predictable, and we can leverage some claims information as well. So Laura mentioned the $2.5 million in potential savings. So we took a look at your data and put a conservative estimate in based on the procedures that we have and able to transition some of those services over, and to be able to leverage this program. Any questions? Pause real quick there.
Board, any questions at this time?
Sure thing.
Okay, Dr. Campbell.
And maybe you all have questions as well. So I love the concept of what you're talking about. I love the one-stop shop idea, and that you have a flat cost, and for the district and thinking about our health insurance, then that absolutely is an enormous benefit to us. But I also think about being a good community partner. So you mentioned Jacksonville and Orlando. I question if there is an ability to negotiate your flat rate with our local providers as well, because that would be the only thing that would make me really excited about this. We are the largest employer in our community. School districts sometimes are, depends on the county and so forth, but in Marion, we absolutely are the largest employer, probably have the largest group of insured people in our community. We know the impacts that we've had whenever we've changed dental insurance, for example, and only having one dentist willing to accept it, and what all of that looks like. So we know what that change, and considering how different hospital providers in our community would look at us sending all of our well, I know it's voluntary, but the intent of sending all of our orthopedic procedures or all of our pediatric orthopedic procedures out of county causes me a pause.
So we've, historically, and this question's been asked for some of our clients that are large employers in certain areas, and we've been asked to have conversations to talk to providers locally. And we've done that and leveraged, like I said, our chassis and our value prop, and how this can benefit them as well as the local plan sponsors and employer groups. So short of it is, yes, we've been able to do that. We will keep that in the local markets. We don't advertise it outside of that specific market. I'll use, we have a large client in right outside of Nashville, and they wanted us to have a discussion with an orthopedic provider, exactly your example, in their area, and we did. So we're in the process of doing that, but we're exclusively focusing on just that geographic region. So we're not promoting that outside of that at the moment, but it's something that we can do and that we've done in the past.
Well, and obviously our healthcare providers, our hospitals, for example,
Yes.
here in town, obviously, I mean, you're talking Nashville, HCA is based there. So
Yeah.
if there are other HCA hospitals that have that arrangement, then it seems like an easy transition just to say, your sister hospital in the XYZ community is doing that. Same thing with Advent Health. I mean,
Yes.
there's lots of opportunity. That's what would make me most excited about this concept, is that we could bring it more local than saying we're sending people 2 hours away. Though I appreciate the stipend.
Yeah. Oh, yeah, sure.
So we feel the very same way, and of course, Gallagher and our office just got access to this program, but we have a meeting today and a call this afternoon with 2 local providers to let them know about the program. And I have an email into one of the large hospital organizations to see about a conversation there as well. So we do believe that, obviously the district, but then as Gallagher clients are able to use this, that it will become a much broader opportunity for more local organizations to join the network.
Thank you.
Reverend Cummings.
Thank you. Dr. Campbell, you were right on where I was at. I wrote down HCA and Advent because oftentimes we overlook the ones that's right beside us or right near us. So I too was interested in that piece, that the availability of our staff being able to get that. My other question is, with this assured excellence, is this a benefit that a employee opts into, or is it just offered to everyone, or how is it being told to the employees what this offers? Is
Yeah.
it extra benefit? Is it an extra cost or anything?
So we do not charge an administrative fee to utilize the program. So there's no per employee per month cost, no per member per month cost. There are administrative components built into the bundle. So if there is a procedure there are two administrative components, and I'll get to the mechanics of the program in a second. One is for the Legacy Assured Partners team, because I have two full-time employees that help me administer and run the program. So if you have a member that calls in, it doesn't go anywhere else. It comes to my team, and her office is next to mine in Hunt Valley, Maryland. So she will pick up the phone, she answers the emails, and she's the one that's talking to them. So they're talking to a live human when we do an intake and have that conversation and transfer them to one of our providers. So we help and work with you to promote the program. It can be put in at any time. It doesn't need to be put in at an open enrollment for your population. And we have some catered communication. We will work with you on what your communication will look like, because you know your population best. So we will do whatever is best for you and your population to communicate what it looks like. I tend to incur it as a super in-network benefit. It's there, it exists. You don't have to use it. I mentioned it's voluntary. They can use that concurrently with what they're doing today. So if they are talking with their orthopedic surgeon and their specialist, they can still call in, and we won't charge for that. So they can still call in and say, I want to talk to the Cleveland Clinic. I have a family member that lives in Miami, and when I get discharged, I want to be there for a few days. So and we're trying to remove some of that geographic barriers Laura mentioned. We're having some conversations today. So we have a couple ways in communication. When the program launches, we'll share, here's what the program is, and we'll work with you on which modality makes sense. And we also have direct communication, so letters that we can send out as well. And we have that in conjunction with some of our provider partners. Cleveland Clinic as an example. If they have some claims data, they can cater some custom communications, again, if you allow that, to be able to send to the members to say, don't forget that you have this program, and provide them with insight into, you can use it, remember it's voluntary, and they'll have a 1-800 number and email to contact, and try to remove some of that inflow of traffic into your team. They can go directly to my team to be able to do that.
And thank you for that. I'm sorry. I'm looking at the list, and some of those on the list are very familiar. But then in this area, we have some specific providers, being in Florida. Of course, you're going to look at the Shands and the Mayo and the Moffitt. Those are places that people here would be gravitating towards because they're local. So I'm hoping you can get some partnerships with those as well.
Thank you, Reverend Cummings. Ms. Thriller?
Sure. I'm in accord with most of the board members' comments so far. I'll take it another step forward and say I really do think something like this would be greatly appreciated. It's all in the way it's implemented. We have tremendous community partnerships with our hospital district and HCA and so many other folks that support Marion County Public Schools. So I would be wanting to ensure that everybody can be on board, with this and benefit from it. I will also say from, thankfully not yet my own experience, but other close friends and family members, that it can be very daunting to try to take the next step, beyond Shands and up to Jacksonville and everything else. And so to have that concierge type service, and where when you call, you're not getting a call center from somewhere that has no idea what our community is like, would be a tremendous comfort to people that are already under a lot of stress, with medical issues. So I really love the concept. I hope that we can, work through it and create this as another new partnership that will hopefully help us continue to market Marion County Public Schools as a great place to come and work because of these benefits and innovative thinking and ways to save and still provide great care and customer service that our employees deserve.
Yeah, absolutely, and
Exciting.
it is. And like I said, all the intake, it's a W-2, well, now Gallagher employee that will pick up the phone, and her name's Chris Draghi. She's the heart and soul of this program. She is wonderful to work with, and we brought another person on board because of all the volume that we're getting through this to help assist. But yeah, and it's a big piece of it is making sure that you're talking to a live human and having those genuine conversations, because when that intake comes in, it's a very momentous time in their life as they're having these procedures. Some of them are very significant. So we want to make sure we remove a lot of that barrier, and they will talk to every single one of these providers. So when we do that warm transfer, each one of our provider partners, they do their own clinical consultation. So we don't dictate what those clinical guidelines are. They're using their own evidence-based guidelines when they're having those conversations to ensure that they're a candidate for those procedures. So it may be that they call in and they may say, you don't fit our criteria, but here's what we'll do for you. So it isn't necessarily to call in and then you get the procedure no matter what. So I want to make sure that that's clear as well, that it isn't call in, you get it. They want to ensure that you are truly a candidate for that procedure and ensure that you truly need it before they actually will schedule it, because some of these are very invasive. And if they can avoid that, they want to avoid that.
Thank you, and thank you for mentioning prevention, because that is a personal favorite of mine and a personal, I think, priority of this whole district. So many of us participate in the STEP challenges and all those things to try to help keep us from getting to this point as long as possible. And so far, so good, with the partnerships that we have. And if we can add a new partner to take us to the next level, I would be all for it if we can work through what's been mentioned.
Yeah, perfect. So I'm gonna go to slide 10 real quick.
Wait, one moment.
Oh, sure.
Dr. Brewer.
Oh, I'm sorry.
Yeah, I just wanted to comment immediately when Laurel presented this last week to the executive cabinet. That was my first interruption to the presentation, was how can we work with our own local providers? So I appreciate Laurel for immediately saying, yes, she's on that. So we look forward to seeing how our own local providers can be a part of this program.
Yeah, absolutely. And that's a big tenet, is to remove that geographic barrier for all of our clients and their members. Perfect. Any other?
Yep.
Good.
Good to go.
So I do want to touch base on our Price MD's partnership, which is our leveraging internationally sourced medications. So this is the one of the components that doesn't require travel. It's leveraging the same exact manufacturer, the same exact drug. So it's not a different drug that's being shipped to the member. So I'll use Humira as an example, or Solar. We have this on here on the slide. The member, again, would still call in. We would confirm that they need to be on the drug. And if they are, then we would, and they want to leverage Price MDs, and the cost savings makes sense. In this example, right now, current cost is roughly $27,000 per script. Our pricing is about a little over $18,000. So there's some cost opportunity there, and that's just one member on one drug. So if you amplify that across multiple members on that drug on an annual basis, there's some significant savings that can occur. So the same member is still getting the same exact drug, they're still getting Stelara, they're still getting the same dosage. So nothing changes from that perspective, but it's being cold ship storage to the member. They don't have to go out and get it. And when they need a refill of their prescription, we ensure that there's still a member on the plan. So we still validate and verify eligibility requirements, and if they're still required to receive the medication, and then we'll send the medication again on a 90-day script. So there are some significant savings that can come through this specifically, and this one does not require travel. We do offer a one-time stipend still built into this. There are two requirements on this program. One is to have a real ID or a passport, and it can be expired because the drugs are being sourced internationally. Those are the only two requirements that are required to leverage this specific program. So if they don't have a passport, we offer a one-time stipend to offset the cost of having to get one. If they have a real ID, then they still get the stipend, and they don't have to provide a receipt for it. It's a one-time, and they get that money.
Any questions?
Okay. Perfect. So, oh yes, I'm sorry. Yes. That was slide 9. So, Option Care Health is our newest provider partner. They're one of the largest independent infusion therapy providers in the country. If you ever have a chance to take a look at your claims, these are what we refer to as J codes. So they're an injection and infusion that occur and are administered and paid through the medical benefit. So it's a drug but it's run through your medical benefit. It's not run through your pharmacy benefit. So we saw that as an area where there's some significant opportunity because these can be significant cost drivers on the plan. So what we did with Option Care Health, again, we direct contracted with them and said, we're going to isolate these very high-cost drugs that we see across many plan sponsors and provide two options. One is to provide a home infusion option, or if there's an Option Care suite, like a physical brick-and-mortar suite, the member can go there and have it as well. So it's the same solution, but we're targeting high-cost infusions, still provide the stipend, transparent pricing and what that will look like, but providing and removing that barrier. So if they want to have their infusion in the confines of their home, there's still a clinician that will go administer the infusion, so they're not doing it on their own. Or if they want to be in an infusion suite, we have that option as well through Option Care Health. So I'm really excited about this because these are the really big cost drivers that exist on the plan. And we can take a look at that claim data and say, hey, here's what it looks like, and here's some potential opportunities. And similar to the communication for procedures, the same thing will exist here. We can provide you with some communication on what this program is, how we can help the members, and how to navigate through that process.
I just wanted to speak to this. So we actually looked through some claims data. It wasn't for Marion County, but it was for another district in Florida. So the same medication, the same dosage, same everything at one site of care was $80,000. At another site of care, it was $6,000. So the members most certainly don't know, based on which site of care that they're going to, what that cost is that is hitting the health plan. And so this is, as Virak said, one of the things we're most excited about is because it will really stabilize the cost of those infusions that's hitting the health plan. And many of these are like cancer infusions. And so having this at their home, we think, is something that the members will see as advantageous and as a benefit versus having to go to an infusion center. However, if that's what they would prefer, there is one in Gainesville, and they could receive that travel stipend if they needed to go up there. And as we've been talking through, with more membership, there is the potential of having something here locally in Ocala. But we're excited about the opportunity to kind of mitigate some of those cost discrepancies with the infusions and also offer it to the patients at their home.
That is exciting. Board, any questions or comments on this item? Okay. Oh, Ms. Thrower.
I just want to say thank you for bringing this forward, because we need these innovative ideas that are actually able to be implemented and executed and find the balance for all of the concerns that we've shared. Again, anything we can do to protect our employees and make our profession more marketable is a huge win for us, and keeping our employees healthy.
Yeah, and that's a key piece of that, yeah, absolutely.
Yeah, I like what Ms. Lingle just said. There may be infusion site in Gainesville and not one here, but that may spur someone to say we need a center here in Marion County or the Villages or something. So that's entrepreneurship and competition. So that's a good thing. That's good for the area.
Okay, thank you.
And I do want to bring to light some things that we're working on. Like I said, this program continues to evolve, continues to grow. We have a cancer diagnosis confirmation program with Johns Hopkins. What I mean by that is if you have a member that unfortunately was diagnosed with cancer, they can reach out to Johns Hopkins and they can do a confirmation, meaning not that if you were diagnosed with lung cancer and then they call and say, no, you have brain cancer. It's you were diagnosed with lung cancer. This is the treatment path that your oncologist had walked through. The Johns Hopkins Oncology Board will go through, they'll gather your medical information and say, here's, either we agree or we believe that you should do this instead. So it's giving them a second opinion, a true second opinion on, is this treatment path make the most sense for me in my situation, and give them peace of mind. So that was a big piece of this program, and we're expanding that to other oncology providers throughout the country, so there isn't just through Johns Hopkins, and that is virtual. So that can be done virtually. There is the rare instance where they may have you come in, but that doesn't happen often. So that's one component that's actually virtual. The other piece that I'd mentioned when we were talking about the geographic barrier was looking at second opinion services that can be done virtually. So I'm working with the Cleveland Clinic to provide a second opinion service, not just for oncology, but for other procedures as well, where they will meet with their experts, bring in their board, and have that conversation to say, here's what your condition states, here's what we would recommend. Again, gives them peace of mind to say, does it agree with where they went, or is it something different? And they can bring that information back to their specialists, to their provider, and say, I had a second opinion, this is what they said. And then the two providers can even talk to each other as well. So there's that opportunity to have that peer-to-peer conversation. So it was designed, when I was looking at this, to, again, remove a lot of that barrier for the member to have to do all this work, where we remove some of that and provide ease, peace of mind, and ease of administration as they navigate the healthcare space. Another piece was the mental health support. Coming out of COVID, that was significant ask of us. So we partnered with Hazel and Betty Ford for mental health and substance abuse. Also with Eating Recovery Center and Pathlight Mood and Anxiety for eating disorder. So we went beyond just surgical procedures, oncology, and went into mental health and other areas where we're seeing significant claim impact and some opportunity, and tackle some areas where our clients were asking us to look at, provide some of that direct contracting. So as you were asking today and what we're doing today as well, we go beyond that scope and focus on how do we best serve our clients and their members. And here's just a list, a small subset of the providers that we have, Insured Excellence, and then the locations that are located for these providers as well. So just to give you some background, if a member calls in and Chris Draghi picks up the phone and they will say, I want to go to Johns Hopkins, or can you give me options on where I can go to have this procedure, or I want to stay in the state of Florida. They can tell us that this is the provider they want to go to if it's within our provider network. And then we'll do that warm concierge transfer over to that provider for them. So when the provider picks up, they know that it's a Marion County employee or dependent. They know that it's the Assured Excellence program, and they navigate that differently. So we have a dedicated team with each one of these provider partners. So when we come in, they know what they're asking for, what's going to happen, how the procedure is going to get paid, the stipend, all those components. So they're well educated on what needs to happen, what levers have to happen when the member comes in and has the procedure done. Perfect. So I'll walk through some of the levers for this program. The claim is still paid by the plan sponsor that we've pre-negotiated for the claim. The claim itself runs through an independent TPA, so it does not run through Florida Blue. Florida Blue will not see any of these Assured Excellence claims. So we have it run outside an independent TPA, and I mentioned those administrative costs. So within that bundle, a portion of that, 3 to 3.5% of the total bundle, is for the TPA to adjudicate the claim. So that TPA, when the claim occurs, will tell you that, hey, Sean Smith had a claim. This is what the claim was for, and ask for payment for that claim. The independent TPA will then pay the provider. So part of how we were negotiating these lower costs, where the providers are getting paid much significantly sooner than what Florida Blue would pay them. So in our contracts with all providers, it was 10 to 15 days that they get payment for these claims. So that was a big piece on how we were able to negotiate these lower costs for these procedures. Once a claim occurs, then the stipend gets released to the member. So there's a different stipend amount for each procedure. So if someone has an organ transplant, right, significantly higher claim, they're going to be required to stay inpatient longer. We built in a larger stipend to offset that length of stay that's required for those procedures. So when the claim occurs, then the stipend gets released to the member, and then the claim gets paid to the provider, and then we retain our administrative components. So again, we were looking to remove a lot of that administrative barrier for you as the plan sponsor, and as well as for the member. Any questions? Okay, perfect.
Great. Thank you. So again, we're very excited about the opportunity to introduce this program. We're excited about the opportunity to grow this program. within Marion County and the state of Florida. Completely voluntary. It is provided at zero cost to the member with that travel stipend, so we do believe that members would be interested in at least exploring this as an opportunity. If you have a knee replacement now on Plan 1, you have a $2,000 deductible and a $6,350 out-of-pocket maximum. I anticipate with a knee replacement surgery, you would likely meet both of those numbers. Again, going through this program, it would be provided at no cost to the member, and then the district would be saving as well. So excited, like I said, about growing the program, introducing it. As Virac said, it can be introduced at any time. We would have to update the contract with Gallagher to include this initiative, but we do not need to wait until open enrollment to roll it out, or 2027 if the board was interested in putting it in place, you know, potentially for the start of the school year or some timing like that. So again, as Mr. Welsh indicated, we'll be coming back with recommendations at another board meeting or for approvals at that time. Just some other cost-saving strategies that are included in that initial projection where the increase would be at about 8%. So we will be seeing some of the additional rebates that we're experiencing this year into 2027 because of how the rebates are paid. So they're usually paid 90 days to 180 days in arrears, so we will be seeing some of those in 2027. And then working with our retiree population with some alternative health solutions. So we have about 159 members that are retirees that are currently on what we call the active plans. So they are on the same plans as our current employees are. As a state entity, you are required to allow retirees to continue to remain on those plans. We believe that many of those members are on the plans because it's comfortable, it's what they know. It's not always that it's the best solution for them, or that it's not always even the most affordable solution for them, but it is most certainly what they know, and so they remain on those plans. We are suggesting reaching out to those members with a concierge program for education and letting them know what other benefits they might be eligible for. So those over 65 obviously have lots of options through Medicare. Those under 65 have other options as well. So this would not be a requirement that they come off of our plan, but just giving them the opportunity to look at what other insurance benefits are available to them. One, that might actually meet their needs better, and two, potentially are more affordable than what they're currently paying to remain on our plans. When we look at just the retiree population that are on our active plans, again, some of those are under 65, some of them are over 65, we have a loss ratio of 145%. So for every dollar that is being paid in for that benefit, we're paying out $1.45 in their medical claims. So it's most certainly a population that is a high utilizer of benefits. And if we can find them solutions that might actually work better for their healthcare needs, it would be advantageous for both the board and that employee. So we did some conservative savings there by offering that solution. Again, it's really more about education and letting them know what is available to them than it is a requirement to come off of the plan. And just some additional considerations. We've been working with Mr. Welsh and Dr. Brewer about what other solutions are out there for potential cost savings. A partnership with Heart of Florida, so they provide primary care, but really one of the services that they provide that's advantageous is they have 340B pricing for high-cost pharmacy medication. And so that is one of the meetings that we have with Virac this afternoon, is to see if we can potentially get Heart of Florida as a partner under Assured Excellence to be able to utilize their pharmacy benefit so that we as a district can save on the cost of those high-cost medications. So they would still have the opportunity for the international sourcing, but this would be another opportunity to get some of those high-cost medication at a lower rate through that partnership with Heart of Florida. Just some other considerations. I'm not sure that the juice is worth the squeeze necessarily on some of these, but something that we wanted to bring forward. So currently, Plan 1 is a PPO plan. You could consider moving that to an HMO network. You can see that it would result in about a 3% savings on claims. HMOs are usually negotiated at a lower rate than a PPO is. So about 845,000 claims based on the current Plan 1 claims and current enrollment. I did put the asterisk that there would be union consideration. I believe that the union contract indicates that the free plan is currently required to be a PPO plan. So that would be something that you would have to work with the union on. This is something that would impact a significant number of the employees, which is why I made the statement that I did previously, that I'm not sure that this solution really warrants the disruption to the potential 4,200 members for less than $1 million in savings. And then the other one is prior to 2024, Plan 1, the plan that's provided at no cost, had a generic choices formulary. We moved that to cover some brand medication. If we moved back to that generic choices on Plan 1, would result in about $5 million in savings. Some caveats to that $5 million in savings. Employees that are on that plan utilizing brand medication could most certainly move to a different plan that has brand coverage. So then there wouldn't be savings if those employees moved. And then that $5 million does not account for loss in rebates that we would experience. So if the members are no longer getting the brand medication, we wouldn't be getting the rebates associated with that brand medication. That is never an offset. We're never getting 100% of rebates back in what we spend. However, it is a consideration because we are taking into account current rebates into our projected numbers. So you can see that it impacts just about 800 members, but nearly 3,000 medications. So this would be a big impact as well if this was something that was considered. So that wraps up essentially the portion of cost containment strategies. Are there any additional questions about that?
Board, anything else? Dr. Campbell?
I just wanted to go back over the retiree part. I think I understood what you were saying, that we would be working them off of our plan. Tell me again about benefit solutions that are outside our plan that we would be talking through with a retiree.
Sure. So those that are over 65, it would most certainly be a Medicare conversation. Under 65, there are, direct marketplace programs available. Some of them might be eligible for stipends depending on what their household income looks like. Sometimes there's programs out there based on specific conditions that provide insurance solutions at either reduced or no cost because of that specific condition that they might have. So it would just be exploring what opportunities that particular member, it would really be working with all 159 members individually to see if they qualify for any other solutions that meet their healthcare needs more effectively or is provided at a lower cost.
Sure. So just as a naivety question, so our current retirees are paying into our system, and we're believing that they and we might be able to get a better benefit if we work them out of the system.
Potentially, correct. So the retirees that are on the active plan pay 100% of the cost to remain on our policies. Okay. And in some instances, it might still be the best solution for them to remain. But as I mentioned, we believe that sometimes it's just what they know and it's the easiest transition. So we're providing them what other options might be available.
Got it.
Yep.
Ms. Thrower, did you have something?
And you may not have this number off the top of your head, but I'm wondering, what the cost is for our retirees to, say, remain. Plan 1 probably has the most interest to me, just because I've been on it like my whole career.
Right.
And the deductible's gotten much higher over the years, but it still has been helpful. And I'm going to be likely in a kind of a little pause before I turned 65. So I can just use myself as an example for the question.
Sure. Yeah, so I do know the cost of employee only on Plan 1. It's about $743 a month. So for some, that may be the best rate for those benefits, and if they're not high utilizers of benefits, it might be the best option for them. Plan 4 is well over $1,000, so those retirees that remain on Plan 4, you know, that's a big chunk every month to be coming out of pocket. So again, it's not a requirement that they come off of these plans, just educating them about what else might be available to them, and it's a unique scenario for every member.
Right. It certainly doesn't hurt to have the conversation, and I think that that's actually really important. The other thing I'm remembering, Board, is that we had a lot of interest and need for employees to be on medications that aren't generic, you know, that are expensive. So just kind of wanted to jog everyone else's memory on that as well, that would be, again, maybe worth having the conversation, but proceeding with caution, just because we also had a lot of appreciation back from our employees that we did do that. So.
And potentially with the savings from the Assured Excellence program, with some of those medications, we can keep that in place and direct the members to that to see some savings as well.
Right. Thank you.
Thank you, Ms. Thrower. I have a question also that I forgot to ask you yesterday
Yes.
when you were so graciously spent time with me. Do we know how many are not using their insurance? Like, do we know how many employees don't use their insurance at all?
I don't believe that we have that data to show that they've never had a claim. I could reach out to Florida Blue and determine if that's something that they would be able to find the data on.
Okay.
I don't know. I'm not exactly sure on that.
All right, thank you.
So as we move into some plan funding analysis, we were asked to research some of the other counties throughout throughout the state of Florida to see what their plan looked like. Do they offer a free plan? What is the cost of family coverage, et cetera? So you can see across the board some of the counties that we reviewed. There are a couple that are Gallagher clients and others that are not. We just found this information because it is public information. And then after I presented to the executive cabinet, they also asked us to research some other counties that are either similar in size or geographically located near Marion County. So you can see in this presentation, the majority of the policies do offer at least one free plan. When we were asked to look at some of the other counties, that shifted slightly. So we looked at Florida Virtual School. They are a Gallagher client. They don't offer a free plan. It's about $72 a month, but they do offer $1,200 in medical expense reimbursement. So you essentially would get a free plan if you utilize that full $1,200. St. Lucie County, I understand that they are similar in size to Marion County. They're currently at $83 a month for their lowest cost plan. Alachua, again, not similar in size, but obviously geographically similar to Marion County. They offer 2 free plan options, and they also do offer something for employees that do not take the insurance through the district. We talked through that with Dr. Brewer. It was something that she asked about. It is something we can explore a little bit further. I would say there are a couple of caveats that I would like the board to consider if that's something you want us to research. One, administratively, somebody would be collecting an affidavit or proof of other insurance, et cetera, so there might be some administrative burden there. If you only required an affidavit, potentially I would be fearful that people would say, no, I don't want the health insurance, I'll take whatever stipend you're offering, and not access other health insurance. If they're young and healthy and they say, yeah, I'm good, I'll just take that. I think that there could be some risk in that, and I also, just how insurance works, if we take away all of the people that are not using the health plan, we are going to have adverse selection. and we are going to have higher claims, lower premium coming in, and that might not be the result that everybody believed would come from a strategy like that. Levy County is $123 a month, and then Citrus is $126 a month. So I wanted to talk through those that aren't on the presentation, but we did that additional, get that additional information. So across the board, I think that the biggest discrepancy that you are going to see is the cost of family coverage, Marion County, in comparison to the other counties. So our Plan 1 family cost per month currently is $335. Osceola is the other county that's similar to us, but then across the board, most of them are at least double, triple what our employees are currently paying. Some of them do offer a wellness incentive, so they may get a better plan at no cost. If they do the wellness program, they may receive a discount on their insurance if they do a wellness program. So there are a couple of districts that offer something similar to that. That would be a union consideration again, if that is something the board wanted to consider.
I'm sorry.
Yeah, yes.
Sure. Well, and I'm processing. So we know that Pasco has their own health facility. So like they have that conglomerate with the county. Are there any of these other counties that have the same setup as Pasco? Because essentially they're paying themselves for all the care. Because they have their own clinic, they have their own facility that all their health care comes through.
Right. So it wouldn't be all of their health care. So their primary care would be going through that clinic, but any specialty care, surgeries, medication, I mean, they likely have some generic medication on site there, but those would all be going through their health plan and their TPA. So I could find out if others have a clinic model, but I wouldn't say that everything is going through their clinic. A subset of the claims would be going through their.
Sure, I just found that interesting, first of all, that they're an HMO instead of a PPO, and secondly, that they don't have a zero cost for their employees, so all of their employees are paying in, but potentially that's offsetting the costs of what they have to have their clinic. So I don't know, just that stood out to me, and we know the uniqueness of what Pasco offers, and anyway, if there are others that have that model, I'm interested in knowing what that looks like.
Sure, yeah, we can look into that for you.
Thank you.
Ms. Lingle?
Yes.
Question, are there any districts that we know that offer both HMO and PPO?
Yes.
Because I would like to see how that lines up with this as well.
Sure. We can, if you're good with us reviewing the districts that we presented and then the handful that I found out, we can review how many of them may be, because potentially their base plan is an HMO, and then if you want to buy up to a PPO, that frequently exists. So we can find that out for the groups that are,
Thank you.
We have presented here.
Did we used to do that?
Yeah, I
Yes.
feel like we used to do that.
Yes, I think
Yeah.
it gave us, well, I wasn't in the district, it gave them options. And I think in this day and age, you kind of need some options to look at and weigh your costs.
Yes, Mr. Ower.
A couple things jump out at me too with this chart in comparison between counties, is that how is Lake affording this? It's a PPO. What I'm seeing is no individual deductible with an out-of-pocket max of $2,500.
So Lake County has what I would call a dual option program. So their low or their no cost plan is a contract with Orlando Health. So members that accept that plan must utilize Orlando Health services. If they want to go outside of Orlando Health, then they buy up to a plan through Florida Blue.
So it's an Orlando Health network that they have to stay within.
Correct, which for some, that's perfectly fine. It's something that we've looked into for Marion County. Unfortunately, there aren't any TPAs out there that work specifically with either HCA or Advent. It's actually the same TPA that facilitates Lake County's, does have a contract with UF Health Shands. We just didn't believe that UF Health Shands has enough footprint in Marion County right now. They are coming this way, that it would be advantageous or beneficial to our employees at this time. But always something that we're looking into as those things change. But that is how that plan is set up, and why they have that lower deductible is, it's a little bit like Assured Excellence. They're trying to drive to the lowest cost. It's just, if you take that plan, you are required to utilize Orlando Health for all services.
Understood. Thank you for explaining that. And then with Osceola, they seem to be, pretty competitive. I do like the idea of potentially looking at the possibility of an HMO along with PPO for a certain plan. But I'm a little shocked and dismayed about that there's no real wellness incentive with any of these, including us, except for Osceola. And I thought we were doing a lot with wellness. So maybe it's a different definition of wellness incentive.
Right, so we have wellness programs, and many of these districts that have a no also have a wellness program. These districts say if you complete A, B, and C, you get your plan at no cost. But if you don't complete A, B, and C, you have to pay $50 a month for your health plan. So it's built into the health insurance. Again, there would be some union consideration if the board was wanting to look at something like that. And also then administratively, you would essentially have to have somebody to administrate to that. Dr. Brewer asked about it as well. Just personally from my wellness background, sometimes I look at those things as checking the boxes, and are people actually getting healthier by doing the requirements? There are also several government requirements that go into that say if somebody comes to you and says, I can't do Part B, you have to give them consideration. And so sometimes it can be administratively burdensome to have a stipend or a reduction associated with your health plan and a wellness program.
Right, and I can see how it could get complicated. I guess I was thinking more that for on the preventive side, that if somebody does show up for their blood pressure screenings and, in the interest of catching something sooner, that there could be some type of incentive for doing that. I don't know. But we're thinking outside the box even more already, with the assurance. And so I just like the direction that the thinking is going, and it's nice to see these comparisons between the other counties. It does show that we're competitive, and that's good.
Yes.
And just piggybacking off of Ms. Thrower, it seems like I remember we had those wellness plans, wellness incentives for like weight loss, for smoking cessation, those different types of things. Did that go away, or?
No, we still offer all of those things. We just don't have an incentive tied to the health insurance plan related to your participation in a wellness program. So that's what all of those are, is can somebody have a reduced cost for their health insurance because they participate in wellness programs? That's what that yes, no at the bottom is. Yes, yes.
Okay. Any other questions? Dr. Brewer, did you have anything you wanted to add?
Nothing.
Okay.
So it was requested for us to do some funding modeling, and so we have done 12 scenarios here. Back to the first couple slides of the presentation when I said that our projection did not include an increase in the aggregate number from the combination of the board and the employees. So these numbers are modeled off of that aggregate that is currently being paid out, but shifting some of the costs. So the first 4 scenarios essentially would be impacting costs for family coverage with a little bit of impact on costs for employee coverage. So the first scenario would be reverting back to the cost structure for 2023 and before that. So for 2024, we reduced the cost per pay period of family coverage by $100, which equates to $2,000 a year. So essentially, if we reverted back to that cost structure and then rounding the employee contribution just so that it's a round number, you can see what that results in for savings to the district. At the end of this presentation, I have what that results in for the employees per pay period, so you can review those. In the next one, it would be if the district funds 100% of the employee cost for Plan 1. So right now, I said it's $743. They would apply that $743 across all other single plans, and then the district would pay 60% of the family coverage and the spouse also employed coverage. The next scenario is essentially the same, 100% of Plan 1, apply that across all other plans, and then pay 60% of family coverage and 50% of spouse also employed. You will see we gave that scenario when you look at the appendix, because the spouse also employed numbers get a little tricky with where they're currently at. So the 50% kind of put it more in line with them not having a reduction in cost, which is what we were seeing at the 60%. And then again, 100% of the Plan 1 single rate, and then 50% of the coverage for family or spouse also employed. This would continue to meet the union contract, as that states that there has to be a free plan offered to the employees. So these 4 scenarios would meet that contract. Moving down into the next 4 scenarios, we looked at what many of the other districts, if they charged employees, what they were paying, and it seemed to be around $50 a month. Some of those other districts that we reviewed just recently are higher than that, but we looked at $50 a month. So if we increased the individual cost by $50 a month, and then did the same results that we did in those 4 scenarios above for the family coverage, you can see what that would result in there. And then the final scenario is essentially what is the most that an employee could pay for coverage. So we are required to meet regulations by the Affordable Care Act that says employees can only pay a certain percentage of their household income. Now, the government says you use the individual's payment versus household income when calculating this. It can get somewhat tricky if you're having to track every single employee to ensure that you're meeting that regulation. So they allow you to do national poverty level and do a percentage of that. So that is what we base these last 4 scenarios on. For 2027, it'll be $129 a month. We rounded down slightly to make it $125 a month. But if the employee only costs increase by $125 a month, and then the family coverage, again, follows that same structure that we reviewed in the scenarios above, those would be the results. So this was, what was requested, that we show options of what that funding might look like.
Board, do you have any questions at this time?
No.
Okay, thank you. Dr. Brewer, you're good. Okay.
These next scenarios just go over each of those funding options. If you were to maintain that in the health fund balance, we don't believe that that's the desire of the district, that you would use that savings with the general fund. But if you maintain the savings in the health fund balance, instead of losing the 5.8, each scenario, this is what the resulting loss for the health fund balance would be. Again, it's my understanding that you would keep it in the general fund and not in the self-fund balance, but just for your information. Any additional questions on potential funding strategies? We spoke about this earlier in this year, and that is the Medicare Advantage plan. So I know we just talked about those employees that are still on the active plans. The school district offers a Medicare Advantage plan for those that are age 65. We are requesting that this be considered for a sunsetting for 1/1/2027. If you remember when we spoke about that in the last 2 years, we've only had one retiree join these plans. Outside in the direct to Medicare Advantage plan market, there are hundreds of plans that employees can enroll in. We're only able to offer 2 plans. We essentially, whatever the rate increase for those plans is, we have to accept that. Then the retirees that are on those plans take that. So similar to the solution that we were providing before is education on what other plans are available to them. Again, these are all employees that are over 65 and eligible for Medicare. So there's traditional Medicare, there's Medicare Advantage plans, and a wide range of those types of plans available to these members. So we would be reaching out to each of them individually. We would be sending a letter to each of them individually and then pairing them with a benefit consultant to find the plan that works for them. This, different than the program we talked about before where former employees are still on our active plan, this plan, our recommendation would be that it would be sunsetting for 1/1/2027. And we have just under 200 former employees that are on these plans. And then lastly, we are currently wrapping up the Vision RFP, so it occurred just a couple of months ago. It will be in effect for 2027. We had 4 carriers that submitted proposals. We're in the final negotiations with the highest scoring carrier. We are going to see some slight cost savings to the member with a little bit of a benefit enhancement on the Vision plan. And then looking forward for 2027, again, at the end of this year, we will be doing the stop loss RFP to go into effect for 2027. We will review that gene therapy rider once again. It's something that we look at every year. So you have coverage for gene therapy. It's just if you experienced a gene therapy claim, it's likely that that member would then be lasered for the following year. So the gene therapy rider protects against kind of the fallout if there is a gene therapy claim. The dependent audit, this is something that's required for self-funded health plans every 3 years. So you may have participated in this audit before. If you have any dependents, a spouse and or children on your health plan, you receive notice that you're required to provide proof that they qualify for that plan. Marriage certificate, birth certificate, adoption paperwork, etc. They do use a third party to help facilitate this audit, but that is something that will be done in 2027. And then we'll be coming to the end of our first year of the new pharmacy contract here at the end of 2026. So it's always recommended to do an audit to ensure that the contract is being paid appropriately and according to the negotiations and terms of that contract. As I mentioned, there is an appendix with all 12 funding scenarios and what it would look like for the employees. I think for time's sake, I will let you review those and see what that looks like on the employee side for each of those 12 scenarios.
Okay. Thank you very much. Board, do you have any questions or comments as we wrap up? Yes, Dr. Campbell.
Thank you. I don't have any additional questions at this time. As the board's representative to the insurance committee, I anticipate and look forward to the robust conversation that we will be having shortly.
Yes. Yes.
Okay. Anyone else? Ms. Thrower.
I was just wondering about the timeline when the recommendation from the insurance committee may come through.
Mr. Welsh can answer that question.
Thank you. Following this presentation, I will coordinate a date. I expect that we can get that done hopefully between now and tentative budget. So the timeline is such that we would want to move as quickly as possible with due diligence and deliberation, because this is a very touchy subject and we need to move carefully and do what's in the best interest of our employees to provide high quality care, but more affordable cost for the long term. So more to come, and I look forward to that discussion as well.
Thank you.
Thank you, Mr. Welsh. Thank you, Ms. Toller. Anyone else? No? Okay. Mr. Rios-Welsh, Ms. Lingle, I just want to say thank you for the time and energy, research, all that's gone into not just the presentation this morning, but really informing our district leadership team and us as well, so we can make good decisions. Thank you so much. Thank you. All right, do we have any public comment?
Yes, we do.
Oh, we have one. Okay, thank you.
Avery?
Good morning, Mr. Avery.
Shouldn't have sat in the back. That's a long walk.
Long way down.
I always sit in the back.
But hey, maybe you'll get an incentive for it.
Get your steps in.
Had to be at least 20 steps.
Good morning, Mark Avery, President of Marion Education Association. I'm disappointed in how we've done this, because in 20-plus years, we have never done it in this steps. We've never had the committee meeting after the fact
Yeah.
that I'm aware of.
Can you talk into the mic?
I sure can.
Thank you.
So we've never done it that way. The committee has always met in the spring if we've had to meet in the fall, but we've met multiple times in the spring with all the employees having representatives on that committee. And now it's being shared that we're going to now convene the committee after the fact. And now we also have a shortened timetable because time is of the essence. And it's normally in June when they always present the insurance information. That is generally what happens in June or July. But we've always had those meetings prior to that. And so now we changed that without telling anybody that. And that's not fair to the employees. I understand this is a difficult conversation for every district in the state. And there's lots of different options and scenarios that they are doing. The only comment, I could make lots of comments and I'll save some of those for other meetings, but I would say that I think it's called the Assured Advantage. That's not the only program that's like that. And there's lots of other districts that are doing a similar type program that's not that one per se. So I think that that's not something, I'm not disagreeing that those aren't things to consider. I'm just frustrated or disappointed that we did this a different way, that we've never done before, especially if these are such major decisions that have to be made, why we would suddenly change the process. And that doesn't seem to be the normal for the board. They want to be, you guys always try to be transparent and upfront. And I mean, how many employees know even about this presentation? Because it happened in the summer. And if you had the committee, those representatives go back and talk to their people. And then you could have had the presentation here. So that's my frustration. And I look forward to these future meetings. Thank you.
Thank you, Mr. Avery. Any other public comment?
No, Madam Chair.
Okay, thank you. And with that, we'll wind up on our insurance presentation. We're going to move on to item 5.1, Central Office Staffing Plan, and I invite Ms. Morant to the podium, and she's already there. Good morning, Ms. Morant.
Good morning. Thank you and good morning again, Dr. Brewer, Vice Chair Conrad, and board members. As mentioned, I'll be sharing the proposed changes to the 2026-27 Central Office Staffing Plan. As you recall, we previously presented the initial proposed 26-27 Central Office Staffing Plan at the March 5th work session and subsequently presented it for approval at the March 24th board meeting. At the March 24th board meeting, you all approved the reduction of 4 positions and the addition of numerous positions in support of South Marion High School. In addition, we moved various positions between departments. For example, 3 positions seemingly added to the secondary department were actually moves from other departments. The central office staffing plan document attached to today's work session includes the previously approved plan. The proposed changes being presented today are highlighted in yellow. The recommended changes include upgrading the Supervisor of Employment Services and Food and Nutrition Services position to director positions, as well as upgrading the Risk Management Specialist position to a coordinator. It includes cutting the Coordinator of Student Discipline position, cutting a teacher with Marion Success Academy in exchange for adding 2 special needs paraprofessional positions, and lastly, the additions of 10 bus aides. The total net cost of the recommended updates is $272,157. In addition, we are unfunding 14 positions for a total savings of $937,986. The approximate cost of the current approved 26-27 central office staffing plan is $97,048,103. The proposed changes presented today will add $272,157 to that amount. I want to note that moving the work-study teachers from Bridgeway Academy School staffing plan to the ESC department adds $769,868 to the central office staffing plan. But it's important to note that these are not additional or new funds for the district, but simply a move from the school budget to now the department budget. As shared, unfunding the 14 previously mentioned positions decreases the cost of the central office staffing plan by $937,986. The total cost of the proposed 26-27 central office staffing plan as presented today is $97,152,142, which is an increase of $104,039 from the originally approved plan. However, as mentioned, approximately $700,000 total move of the work studies teacher is not a true addition. So removing that amount really represents a decrease to the central office staffing budget in comparison to what was approved in March by a little over $600,000. With that, I will turn it back over to Dr. Brewer.
Go ahead. Dr. Brewer, do you want to add any comments to that?
I don't. I just wanted, she said it very well that the bulk of the approvals were completed by the board on March 24th board meeting. So that, just want to make sure everyone is aware of that.
All right, thank you very much. Board, I open up to you for a conversation. Yes, Ms. Thrower.
Thank you, and thank you for that very concise and straightforward summary of what the plan is proposed to be. And, you know, as soon as members of the public see central office staffing plan, there's an immediate assumption that these are folks that don't do anything for kids. And I just wanted to highlight and say again that we're looking at adding 10 additional bus aides. Did I hear that?
That's correct, yes, ma'am.
Which is something that many folks think is critical, you know, for the safety of drivers and being able to retain drivers and all of those things. You know, in the best world, kids would just behave. They're sitting in air conditioning and taking a ride on a bus. But anyway, I digress. And then also adding, it is reducing one special needs teacher, but adding 2 special needs paraprofessionals.
Yes, ma'am.
Which again provide direct support to students. So I just think it's important to highlight that because again, folks have their own interpretation of what central office or county office and everybody's sitting around drinking coffee or something. I would invite them to apply for a job. That being said, I was aware of the decrease in staff and student discipline. I'll support it, but I continue to be just a little nervous about that. You know, we've been through some times with discipline, and again, it's something that the community is very aware of. You always hear the negative things when kids engage in those behaviors that they shouldn't. and we've come a long way in just really making sure that the process is well communicated and, you know, families are involved and informed, all those great things. So I know that, and I would expect that operations will keep an eye on that, and if it looks like help actually, you know, it would be best to add that position back because it would save money and things in the long run and difficulty. I would be happy to have that conversation, you know, again. And I know we try to monitor everything, but student discipline is just so important and it's foundational to me, you know, just like attendance and transportation. Thank you.
Thank you, Ms. Thrower. Board, Dr. Campbell, you look like you're about ready.
Well, I'm processing. So I appreciate the robust conversation we had back prior and how important it was to this board to ensure that we were not giving increases and all, you know, we made some very specific moves. While I understand as we continue to massage what next year looks like, really in conception, a couple of these positions do need to be upgraded. And I don't disagree with that. So I completely respect what Ms. Thrower has said, that several of these employees that we're adding, the special needs paras and bus aides, are directly impacting students every day. And so the thing I'm going to say and want to say is I know that our fourth calc numbers came out and they're a little better and stronger than what we thought they would be. So we know that we're going to have a little bit more money to play with, and I'm using that loosely, than we thought we were going to. However, where I continue to sit is the first thing we have to do with that extra money that we now have is to replenish that reserve fund that we took from in the first place. And I know that I'm making statements that don't necessarily directly relate to you, Ms. Morant, but just because we have an overage doesn't mean we need to start spending more money. We need to actually start replenishing the money that we took from the fund that we fortunately set up before that, so we would have some kind of board reserve. I keep calling it a reserve. It's not really that. Anyway. So that's all my concern, I guess. Anytime we're adding something that looks to be additive. However, when we're talking billions of dollars in budget and millions of dollars that we're going to be having to the good now, it appears $100,000 is kind of negligible, and that sounds a terrible word because it's not. $100,000 is definitely not negligible because we want to count every penny. But I can understand and respect the decisions that we need moving forward for the 26-27 plan. So just needed to air all my grievances. Thank you.
Thank you, Dr. Campbell. Reverend Cummings.
Thank you, Ms. Morant. I don't have any grievances. I appreciate what you guys have done in response to the board back in March when we gave our concerns. We shared our heart and our angst against approving some upgrades and some different situations. So when I look at this upgrade and cuts list and what you've done since then, you have taken our conservative mindset and really went to work on this. So I truly appreciate it. I understand these are necessary. Some people are going to be look at us and say that we approve some, we had to. No, some things are necessary. Some things you have to do to maintain good movement. So I can get behind this, and thank you.
Thank you, Reverend Cummings. And I won't belabor the point. I agree with everything that my fellow board members have stated. I really appreciate the negotiation back and forth and you taking the concern of the board and coming up with a compromise. So I, too, am in favor of this plan, and, too, just want to reiterate of how much of it does directly impact students. So thank you. Oh, Ms. Thrower has an addition.
Well, just additional clarification. I think I heard at the end of the statement that in the end we're actually looking at a $600,000 decrease. Is that correct?
That's correct, because a large sum of the addition, that 700,000, was really us moving the Bridgeway teachers from the school staffing plan to the district staffing plan. But we wanted to, in the spirit of transparency, show that, because it's going to hit that, but it really is just a movement of money.
So it's
So really,
essentially
it
a lot.
decreased. We came back with a lower amount than we presented before, yes.
Okay. Thank you for the clarification.
And some added clarification that Mr. Whitehouse is going to touch on or remind you.
Good morning, Mr. Whitehouse.
Good morning. So I just want to touch on the 10 bus aids a little bit. What we're not going to see in the staffing plan and realized savings, and I think we've talked about this off air, but it's good to be able to state it publicly as well. We are moving away from school district services as a transportation provider for us for Bridgeway Academy for next year. So adding these aids is going to allow us to then take over all of the routes that we are currently contracting out for Bridgeway Academy and internalize those. So that's a multi-million-dollar agreement that we have been paying for, that we can now, with some route optimization that we've been doing behind the scenes, we're going to be able to handle that with the existing allocation of bus drivers that we had already asked for, so no need for increase in drivers. The current number of buses that we have with the new ones coming in, and then adding some bus aids. So even though it's not reflected in the staffing plan cost, on the other side of that with contracts, there's going to be a large savings for us.
Mr. Whitehouse, thank you for saying that, and thank you for addressing the issue with the bus aids. I have recently had a conversation with someone, and one of the reasons we have so much turnover in transportation is because of the lack of bus aids, where someone is trying to drive a bus and they don't have anybody behind them to support them and keeping the bus in order. So this is a positive move, definitely a positive move. So thank you for putting that out there.
Okay.
Just one final comment. We know that the revenue is touch and go right now with long-term planning, but it is definitely our desire to replenish the funds as soon as possible.
Thank you for that.
You're welcome.
Brewer.
Thank you.
So what I'm hearing is you have 4 board members in agreement with this plan, so we'll be ready to move forward.
We'll have it on the June 23rd board meeting.
Thank you very much, Ms. Moran. Thank you, Mr.
Thank you.
Whitehouse. Is there any public comment? Okay, seeing none, we'll move on to our final item, item 6.1, sales tax projects. Update, Mr. Whitehouse. Back to the podium.
Thank you, Chair. Good morning, Board and Superintendent. We're here to provide an update on our sales tax projects. As you know, we've been collecting funds on this for a little while and are finally getting underway with some of our projects. So we just want to do a recap of where we are and some conversations about the future as well. So as we all know, we did get an approval for the half-cent sales tax on November 5th of 2024. We greatly appreciate the voters approving that 10-year plan for us. We know this is much needed funds. This is much needed funds for our school district, and so we are certainly just want to reiterate our gratitude to the voters for approving this for the next 10 years. So the projection over that 10-year period is roughly $335 million that we can put towards some facility upgrades and improvements, and then we are still working on our updated revenues as of this year, so we're actually seeing a little bit higher sales tax revenue than what we had originally anticipated, and so once we get those numbers, we certainly want to come back and then be able to readdress how those dollars are spent. So obviously more money is certainly good news for us and allows us a little bit more flexibility in what we can do on an annual basis. So this is just a repeat of the ballot language that was voted on and approved by our residents. The important thing to point out with the ballot language is that these funds are only used for capital improvements. They cannot be used for operational expenses. And so when we go back in November to ask voters again to approve the referendum funding, it's a totally different pot of money. So referendum funding is covering operational expenses to be able to pay for employees, curriculum materials, supplies, things that we need that are are useful every day, whereas the half-cent sales tax is only touching physical structures and things that we can do through capital improvements. So it does seem like we're being repetitive and asking voters, but we're asking for two different things, and so it's good to make sure that we continue to clarify that. So the half-cent sales tax can be used for expanding, constructing, and improving schools' facilities. Could also be used for debt service, can also be used for technology upgrades. There's a few other things that are included with that, but certainly our priority has been on the facilities themselves, and we'll share some of those updates. So this just goes through what was approved at the work session in December of 2024. These were the projects that the board felt were priorities at the time over the next 10 years of how we could use those funds. So the initial board priorities were the East Marion Elementary doors and walls and Osceola Middle doors and walls. We know East Marion is still one of our few schools that exists as that old open school concept from the 1970s, and we need for school safety to be able to close that. Osceola Middle in the media center is the same situation, so we'll give you some updates on that. Our first big investment will be the Bellevue Santos and Bellevue Elementary combination school, replacement school that is getting underway now. And then followed up with the Donnell Middle and Donnell High School replacement, and then you can see some of the other items that are much further out on the timeline, and we'll go through those in a moment.
Mr. Whitehouse, can I ask a question?
Absolutely.
This might be an oversight on my part, but on the MTI, we didn't talk about plumbing at all? No.
No, we did not.
Okay. I just was double checking, because I know that came up later, I guess, in conversation, correct?
Yes, it did.
Okay.
And when we do our overall operational presentation in July to you all of kind of what we're thinking for the next 5 years operationally, we're going to touch on the Bridgeway campus as well, and so we can come back and revisit that. Obviously, that's much further out in the timeline on the sales tax, so we've certainly have time for discussion.
Okay, thank you for that clarification.
Certainly. All right, so the first project that we have started on is the East Marion Elementary School project. You can see some pictures there of where we are in the process. The GMP was approved back in January for $3.7 million, and we started construction in February. As you all recall, we did a brief presentation. Mr. Pope had worked with the construction company on a phased approach for the construction of those walls, and a lot of that had to revolve around being able to move staff around the campus, not interrupting testing times on campus. Obviously, we didn't want to do construction then. We are continuing to build this summer, and then we'll wrap up next school year and have all of the rooms and walls and everything completed by winter break. And so we're excited to see the progress that's happening. It's making a huge impact already when you visit the campus, but that is certainly underway and well in progress. The next project there that we have started is Osceola Middle School. This one is not quite as big of a project at East Marion, as we're only touching one building instead of the entire campus. So this work will be done by the end of the summer. The GMP for that was $1.7 million to enclose all those wall spaces and enclose the media center itself in the center of that building. The next big project we have will be Bellevue Elementary and Bellevue Santos. We have already started the timeline for that and working through some of the processes that are involved with beginning the construction. So right now, as you all know, we are constructing the replacement Lake Weir Middle School out in the shores. That is slated to be completed by the start of the 27-28 school year, so construction will continue all of next school year on that new school site. Once we move Lake Weir Middle School off for the 27-28 school year, we will then move Bellevue Elementary School to the Lake Weir Middle School site for that 27-28 school year. So we can then demolish the buildings that we need to at Bellevue Elementary to build the replacement school on that site. So we will start construction at Bellevue Elementary early in 2027. We can do some of the prep work and site work at Bellevue Elementary without disrupting the campus. But obviously we want to move the students off to be able to do the bulk of the work that following school year. So completion date for the new school in Bellevue is slated for May of 2028, so it will open up in time for the 28-29 school year. We are in the process right now of selecting our construction manager, and you can see the budget amount that we have for that is $65 million, which is funded over 2 years. and those years are broken out for you there on the slide. So this chart just gives you a quick summary of what we have budgeted for the projects, what our current revenue is, and what we have currently expended for each of those projects. And so for the new Bellevue Elementary School, so far we have expended about $500,000 on some of the prep work. East Marion Elementary School, about the same. Osceola Middle School, about $370,000 have been spent of the $2 million. And Bellevue Middle School HVAC upgrade, you'll see information on that on the June 9th board agenda as we get ready to get underway with that project. And then, of course, we have provided the capital school outlay for the charter schools as depicted at the end there.
Mr. Whitehouse, I'm sorry.
Yep.
If you can go back to that chart, I just want to make sure that I'm seeing it full picture. So our anticipated cumulative revenue, 60.1 million. We currently have already received 49.9. So how much is left of the time frame that we were anticipating to receive the full 60?
Is it? Oh, I'm sorry. I'll step aside.
Yes, hi.
Good morning.
Good morning.
Good morning, Dr. Campbell. I worked with the finance department, and the 60 million is for half of 24 and full 25. So it's for a year and a half. And so far, they gave me this information in early May. We have received 49. So by the time we close out this fiscal year, at least we should have the 60 million. So it's for a year and a half.
Okay.
And then they have what's budgeted and what we have currently in those projects.
Okay, that's helpful. And obviously, just looking at our rough math that we've already done, what we had high level dollar amounts that we had put in, and now that we have GMPs on both of those first two projects, we're already 500,000 to the good.
Exactly.
And so every time that happens in each additional project, then that has more money back into the sales tax fund where we'll be able to utilize that for other projects.
Precisely right. That's quite observant, and I need to talk to Mr. Whitehouse and Mr. Rios-Welch, because we have seen that that's a little increase. When you all approved it, and when the sales tax was approved, it was like 33 million. If talking to finance staff, if we put our 2% escalation, that will be giving us more money. And Mr. Whitehouse mentioned Bellevue Elementary. We will even save from that by keeping 2 buildings. Right. So we should see some sales tax savings from that also.
Well, and that was going to be another question on that. So I know that we're working on right now the who we're going to have build that. So we don't know who that's going to be, and we don't know what that GMP is going to turn out to look like yet. But 65 million projection is probably, I don't want to say way higher, but we already have the design, essentially. I mean, we're building off of what we had already built. So I'm not saying it's the exact same, because it's going to be 3 stories instead of 2. So there's going to be some changes to it. So I understand, but still building.
The capacity will be a little bit higher than Winding Oaks and Ross Prairie, because it'll be accommodating 2 schools, right. Bellevue Santos. And by keeping those 2 buildings on campus, we will not have to go 3-story, and that will save money also.
Okay, all right. Well, all of those things are really good. I think I'm looking forward to knowing what our GMP is on that replacement school. I know we're a little ways out from knowing that, but that will give us a really clear indicator of how well we're doing, not only on how much revenue we're generating off of the sales tax that we weren't anticipating, because I'm hopeful that it will even be higher than what we had budgeted. And secondly, that we're also being very tight with those construction manager agreements and the GMPs, that we're saving money on sales tax, all the different things that we're doing to make sure that we're dotting every I and crossing every T and saving every single dollar we can to put towards additional projects.
Precisely right. That's what we're doing. Thank you.
Thank you.
Thank you, Dr. Campbell. Anyone else? Okay.
All right, so our next project that will come up after Bellevue on the timeline will be the new Dunellen Middle, Dunellen High School replacement project. We have estimated for this project $150 million for the construction. This project will be scheduled to be funded over the next 4 years, and so obviously we have a good bit of time to save those funds to make sure we have the money to pay for that once we get ready to start construction. We are looking at several different options for the replacement of those 2 schools, and so what we're going to do is some site visits of some model schools of what that can look like with 2 schools occupying the same campus, just so we can make sure that we have a visual and can educate some of the folks in the Denellen community about the visual of what that would look like as well, and then certainly gather some input from the Denellen community about their preference for that design. And so once we work through that process, we will have some options that we can share with the board about those 2 replacement schools. So the remaining projects that will be on the timeline for us, closing out the end of those 10 years, we have the $15 million set aside for capital improvement here at Bridgeway. We have the K-8 school in southwest Marion County, and that was added in place of what we had originally talked about with the Hammett Bowen Junior Wing and the Marion Oaks Elementary and Horizon Academy wings. We own the property in southwest Marion County, where we can build a school site, but obviously that will all be contingent upon continued growth in the Southwest, and so we'll monitor that growth over the next few years to make sure that that's obviously where we still want to land as a school district. And then rounding out those last year, we'll have money for a wing at Ward Highlands and money for a wing at Maplewood. As you know, both of those schools have very large portable populations out in the back of the school. So being able to replace that with brick and mortar would be ideal for both of those campuses. So some options for if we are ending up with more money each year than we anticipate in sales tax. One option is that we can allocate some of these sales tax dollars to deferred maintenance. Obviously, we bring in a good bit of money that we can use for that through our capital dollars through millage, but we can certainly also dedicate some of our sales tax. As you all are well aware, we are quite behind on our maintenance of buildings, and so this would be a good opportunity to add some additional work in that timeline. We also have the possibility of investing some funds in technology annually, as those are part of capital improvements of our schools, and so that's another area that we could certainly discuss where some of those funds could go on an annual basis. So our Sales Tax Oversight Committee has been formed, has met several times. We did not meet this week as we did not have a quorum for that meeting, but we will meet again first quarter of this next school year. And the job of that Sales Tax Oversight Committee is to monitor our use of those funds and make sure that we are using the funds appropriately as the voters expect us to do, and then to report to the superintendent and the school board chair if they notice any discrepancies in what we're doing versus what the ballot language lists. And we are conducting audits. We have an audit right now that's being done, and we'll share the updates from that when it's available. So one of the projects that we're going to be working on for sales tax is updating our website. I met with Mr. Benvenuti yesterday to talk about what we can do to freshen up that site. Right now we have agendas and minutes from our independent referendum, independent sales tax oversight committee, but what we would like to do is to be able to put some of the videos and images of our projects as they're working so that our voters can see what the money's being spent for right now. I think it's good for them to see visuals of what the dollars are doing, and have some renderings of some of our upcoming projects. So as we get a rendering of Bellevue, the new Bellevue Elementary Replacement School, the new Denellen Middle High, we can place those renderings on the website so they can see what the future projects will look like, the timelines for those projects, et cetera. Also, of course, having our oversight committee information still on there, but ideally, we just want to make sure the voters see firsthand, if they're not able to get out to these sites, where those dollars are going, because obviously in 9 years, we're probably going to want to ask for it again. And so ensuring that they have faith in what we're doing and that we are spending that dollar as promised will be critical for us to be able to get that message across to our voters. And that is our update.
Okay. Thank you, Mr. Whitehouse. Dr. Brewer, did you have anything you wanted to add?
No, they, and thank you, Ms. Usher, for being here. I want to recognize that
Yes.
today will be her last day with Marion County Public Schools as our senior executive over operations. So thank you to Ms. Usher and all of the work she has done for Marion County.
Yes, we're very thankful you're able to make it this morning. Board, I'll open it up to you. Any comments or concerns?
Ms. Thrower looks like she's
Yeah, I know, I
thinking. don't know
can't,
if she-
y'all are hard to read today. Go ahead, Dr. Campbell, if you're ready, why don't you start?
I can start, and then maybe we'll have a little bit of a dialogue here. So I know what we have already put out there that we're going to do and what the plan is on the remaining projects. And obviously, I'm very interested in the community feedback on the Denell and Middle High. Very, very interested in that, and see if that does cause us to shift directions and change the thought process on what might happen out there. I think having that next year, midway through or towards the, after we really get a grasp of what that campus is going to look like next year, because it is going to be significantly different than what it looked like this year, though not always significantly different. And so and I'm talking about the population of the campus, not the campus itself, because we're not doing any major upgrades to the campus. And yes, it needs major upgrades. Just a couple of considerations and thought. I know that you've proposed what we might be able to do with some overages. And I'm not saying I want to delay any of the projects that we already currently, obviously Bellevue, we're moving forward with that. We will have then potential to reallocate the resource that currently is Bellevue Santos, and what does that look like, and will that roll into monies that we have to use? There's just a lot that's still lingering that we'll be talking about over the course of the next couple of years. But in light of knowing that we have a federal earmark that's coming to us, and potentially a state appropriation we're going to ask for maybe if we agree to do that next year for that early learning center, and again, already just having a $500,000 to the good on the two projects that are in progress, I'm interested in us talking about an early learning academy, what that looks like from a cost perspective, facilities wise. We know that Bellevue Elementary students are coming to that campus at Lake Weir Middle, but what is it really going to cost us to get something up and running in the 27-28 school year potentially on that site? Because we're going to need to use that money. We've already said we're going to use it. How much do we as a board also have to contribute? Now, if we put those plans out, it doesn't mean that we also can't simultaneously have a capital campaign running for an early learning academy while we're having a capital campaign for Booster Stadium. I know that sounds really difficult and outlandish and hard for our community, but people who are interested in athletics are not necessarily the same people that are interested in early learning. And there are two different donor bases that would be contributing. And we've never done a capital campaign, so I understand that. It doesn't scare me. Just because it's new doesn't mean it needs to be scary. Until we lay out our plans, no one knows actually what we're asking for that money to do. And so I'm interested in what that looks like. I don't know if the other board members are interested in talking Early Learning Academy and how much money that actually costs us, how we get that started. Maybe even we then add it so it starts as a pre-K kindergarten first and then it continues to add. I think there's additional opportunities for even that site to be completely redeveloped into a potential K-8 there. What I want to say is, while there's so much growth happening on the southwest side, the other thing I want to say about this, so much growth happening on the southwest side, we know that it is what it is. What will not change, though, I believe, is that the southeast part of the county is going to continue to be populated. And so that also lends, in my mind's eye, to getting these classroom wings at Ward Highlands and Maplewood sooner rather than later. So again, I'm not saying I want to necessarily delay the Denell and Middle High in the projections that we have right now. We know it's going to take 5 years to fund it of sales tax revenue. Once we hear what that community really wants, it may be that we're just building a middle school and then we can move the classroom wings up sooner, or, so I know what we had originally built. I know what we've seen in the first year of collecting sales tax, year and a half, what that's projected to be, and what we've already started working on, and how we already know we're having projected savings built in, because it's not gonna be $65 million to build that replacement school. We're already $500,000 for the good on the 2 projects that are in progress. So I'm just excited about additional conversations that we have specifically to meet the facilities needs. And while I know we have deferred maintenance needs, the reason we have deferred maintenance needs is because we have strong facility needs. And if we rebuilt as opposed to deferring maintenance, there's just a lot to unpack here, and those are my initial thoughts.
All right. Thank you, Dr. Campbell. Board member, yes, Reverend Cummings.
Okay. Thank you, Dr. Campbell. I too, looking at this Dunellen situation, I'm going to encourage that we have these conversations with the community sooner, very sooner, rather than later. I don't think we need to kick that can down the road too far, because just as Dr. Campbell said, there may be some other considerations, and there may be some different views that may help us, that may be beneficial to us as a district in the plans for how we know how we want this thing to go forward, but there may be a whole nother view to this that we haven't considered. So I would love to have that input from the community very, very soon. Very, very soon. That's all I have for that.
Thank you, Reverend Cummings. Board member Thrower.
I would say it's a really exciting position to be in, finally, you know, to have the opportunity to address the so many needs that we know that we've always had. You know, there's a lot of things that got cut from, that never got restored, that would have helped us address our deferred maintenance needs over the years. And we did the best we could not to tax the community until we really absolutely had to. And yes, it does require us now playing catch up, but we're in a sweet spot in terms of the economy down here right now. So the money is coming in and the projections are looking good. So that's all, you know, really good stuff. Some of my initial thoughts is 100% on the Dunellen conversation. Anyone that's driven out through Dunellen lately, you know, development has come to them. And there's a lot of concern out there for their community and what the schools are going to look like. And we know with the conversations we've had about the north side, people will engage, you know, if we make ourselves approachable. So I concur on that 100%. As far as, and some people might say, well, it's because I would be protective of the booster capital campaign. Sure, that's a little bit in my mind, but what's more in my mind is that when it comes to early learning with the data that was just provided to us, that I'm sure Dr. Brewer will continue to highlight, we, the taxpayers, are already paying. And they're really, in my mind, we've got all the evidence in the world to get a good, solid, big appropriation to support early learning. And in tandem with that, to also support a conversation about if early learning, and you know, this isn't my area of expertise, if early learning, if kids can stay in the VPK and pre-K realm, you know, for free until the day they turn 6, and when education then becomes compulsory. Is that true? I guess that's my first question. How long can kids stay in pre-K? To what age?
They get 1 year, correct?
Yeah, it's
Of the paid VPK, they get 1 year.
Okay, just 1 year. And that can be as early as 3, 4?
board.
I think 4, but I.
Okay, so these will be questions for another time. But my point being is that the evidence is just so clear that if we can get the kids early and have have them be in a high-quality program so they're well-prepared for kindergarten, and that if parents then choose to enroll them at 5, then they need to be there under the same attendance requirements as a 6-year-old. If parents don't want, because they feel like junior's still a little young or whatever, but if they've already had that pre-K experience, they should be ready. And I think as a school system, we do a good job, especially with our younger students. If they're not quite ready for 5 days, you know, the conversations can happen. Parent conferences can happen. And junior can start 3 days a week, then move up to 4, you know, kind of fade in. But if we're going to be offering the services, then there should also be a concurrent requirement to be there, because the rest of the kids, you know, need to learn and are moving forward. So it all goes together as a package, you know, in my mind. And I would just love for the Early Learning Academy type concept to be very well supported by the state. It's going to save all of us money in the long run. I think we've proven that, you know, with the data that we've collected, at least in Marion County. And maybe that needs to be a requirement for all counties to collect that kind of data to support the statewide need. I don't know. But those are some of my initial thoughts. Oh, two final last initial thoughts. And I love the idea of moving up the timeline for Maplewood and Ward Highlands. You know, that area is continuing to develop. Those are strong schools. They have great track records, and they have had portable cities for a very long time. So it would be good to get them into brick and mortar. Okay.
That's all?
That's all.
That's all you got?
That's all.
All right, thank you, Ms. Thrower. I will chime in. I agree, kind of going backwards from Ms. Thrower's conversation. The wings at Ward Highlands and Maplewood, sooner than later. That's just when you visit those schools, there are portables everywhere. And those schools are doing great work, and of course, they deserve that. I'm not sure where I stand on the Early Childhood Center. I'd like really to get some information from that community, on the South End community, to see how they see it being utilized as we look at, you know, filling Fordham and getting families to Fordham for early learning activities. What does that look like on the South End, so we're meeting the needs of the people in that community? Again, I'm also in favor of go ahead and collect information from our Denellen community, see what they want. It's just a really important stepping stone before we make final decisions. So really in agreement with the rest of the board, except I'm just not sure where I stand on the Early Learning Center. In my mind, I'm thinking it would have been great, really, to have it part of Bellevue Elementary and Bellevue Santos, where you have those kids coming already. You know, where you have 2 schools that you're going to have a huge population anyway, but it's a little late in the game for that idea. Anything else? I see Dr. Campbell leaning forward.
Well, I mean, if I'm allowed to brainstorm in public.
You are.
So let me
I'm going to give you permission.
What that is. This is the permission to brainstorm in public, because again, community, we cannot speak about things like this elsewhere, and we have to have that. Potentially, Vice Chair Conrad, if we were to have the Early Learning Center on the site that currently is known as Lake Weir Middle School, there potentially would be an opportunity to have that and the Stanton Weirsdale School join that location, potentially. Like, so if the concern is having a full service elementary school population where we also have the Early Learning Academy, that's the brainstorm of how we could backfill, rather than adding yet another couple hundred early learners to the already doubled population of Bellevue Santos and Bellevue Elementary. We could just bring over the Stanton Weirsdale students to that. And maybe you do it gradually. You know, maybe we're building and we're saying, okay, this is going to be all the VPK and kindergartners are now going to be over at this site. And I'm going to liken it to how the Villages Charter School has built their schools. They have the K-1 building, the 2-3, or I don't even know, 1-2 building, the 2-3. They have schools for like small pockets of students. They have a gym and all kinds of great things for each one of those levels, which is really cool. But that's just, again, a brainstorm in public. I think if that is the concern of filling the whole school site, I think that might answer that question. But the VPK part of it, still the 3 and 4 year olds could even be separate on the same campus. And again, this is kind of one of those, like, we need to see the whole picture. We already have seed money, hopefully, coming from the federal earmark. We're really close to having that $750,000. I think there is only one more hurdle we have to clear. And so it's super exciting for us to, in our very first request, to potentially have some of that money. And I think that also will make a state appropriation, if we so choose to make that for next year, this next cycle, would make that even more appetizing to them because we already have guaranteed money coming from the feds for it. So it's something different. We've never had that before. So then if we already had the potential of saying, well, we also already know we have this amount of money that we've saved from these other 2 projects that we're automatically putting into it. And then maybe just there, it's a big picture, obviously, and again, brainstorming in public, but having a little better, whether it's a design build idea, I know we've talked about that a little bit before publicly. If we bring in a design build kind of RFP and say, these are all the things that we're going to need on this site, give us a bottom line. Like, tell us what that's going to look like. And I don't know if it's the best project for that. And obviously, Ms. Usher's leaving, so we can't get her advice on it. But thank you for your service to Marion County Public Schools, and thank you for being here on your final day. But just all of that big picture kind of thought process on this early learning academy. I think it's exciting that we have a space, that we have land. Whether we need to completely demolish buildings on that site or if we can keep some of it and refurbish, if we need to do all new plumbing in the whole thing, but keep some brick and mortar, I don't know. Just lots of thoughts. Maybe we take some of those buildings and totally shell them, but still keep foundation, and I don't know. And some of that may be possible, some of it may not. I'm not a construction manager. Those are my thoughts.
Dr. Brewer.
Thank you. While I have the chance and we're talking about early learning, I want to share the data that I did share with you this week. So I'm going to read a couple lines. So this is our current kindergartners. We tracked their data and we compared it to whether they had a VPK experience or not, whether it was public or private VPK. So our current kindergartners that had no prior VPK started the year at 3% proficiency with English language arts, and then they finished the year at 47%. So those are no VPK experience. The students that had prior year VPK experience started at 10% and finished at 66%. So when we look at those, and I know you have the table, but I wanted to read that out loud because it shows that the students that come to us, whether it's public or private VPK, not only start the year more proficient, but they have a greater growth throughout the year. So I wanted to take the chance to say that.
That was a great opportunity, Dr. Brewer. I'm so glad that you shared that because eventually we put money in and effort in towards what our young people are doing. It's going to save us money at the end of the road. So I agree. I think the whole board agrees. Yes, Ms. Thrower.
That'll be great data to share at our meetings that I know we'll have that are more, informal with our members of our legislative delegation this summer. I think that it's just so important to show that how well it works and what a cost savings that is over time. Maybe there'll be no need to replace that discipline position. For example, kids that are more engaged in school early on tend not to be the ones that have the big issues. So
they also create good habits, that showing up to school and building that routine and being a part of that school community early on, so they all feel like they belong and they have a space. Yeah.
Absolutely.
Okay.
Absolutely.
Anything else? Yes,
Just
Ms. Thorpe.
anecdotally, representing Fordham, I think it was shared even to the board that there are families that are driving from the south to Fordham to drop kids off and then driving back south to go to work. And Fordham is doing great enrollment-wise. So if some of the students then could be served at the south end, I think we would need more concise numbers than what I just shared, but it appears anyway that there's an appetite for that and a blooming need, shall we say.
Okay. Thank you for sharing that, Ms. Thrower, and we're in the weeds a little bit, Mr. Whitehouse, I apologize. But the reason I was concerned because I thought we struggled meeting our next goal for enrollment at Fordham. So maybe I misunderstood that conversation early on, but that's why I was saying if whatever we do in the south end, that we make sure our families, that's what they want and that they're going to participate. And if you have an elementary school right there or nearby, you're just upping the opportunity for everyone to participate. So that's what I had in my mind when I was talking about the proximity and making sure that we keep and have a full enrollment there. Yes, Mr. Whitehouse.
Yeah, so the pre-K and kindergarten enrollment is very healthy at Fordham. Where we start to lose students is first and second grade. And for most of them, it's because they're trying to figure out what their path forward is going to be beyond second grade, because it's harder to get into schools the longer you wait, and so they tend to depart. And we'll provide some updates on some possible solutions for that in July when we talk about our plan. But their pre-K numbers are very healthy, and actually their summer VBK enrollment right now is stronger than it's ever been. We've had a really good demand this summer for it. So we're excited to see a greater demand, and hopefully we can keep that momentum going into the future.
Fantastic, because there is great work going on at Fordham, and I'm excited for their success. Mr. Whitehouse, do you have anything else that you need from us as a board? As I look at the remaining projects, I feel like we were in agreement on all of those. We just got in the weeds on the Early Learning Center for today.
No, ma'am, that we just wanted to be able to provide the update to you. Certainly we'll have more conversation again in July as we start talking about our comprehensive operations plan moving forward.
Okay, thank you very much. Ms. Thrower's raising her hand. She's ready.
Might as well throw in one more
Okay.
element of brainstorming in public, speaking of having land available at the south end and Lake Weir Middle and all of that. We probably want to continue to keep at the forefront the need for a special needs shelter for a hurricane. And because that area is growing so quickly, that could be helpful. And in the spirit of public-private partnerships and planning together and having conversations together of how we can best utilize taxpayer property would be what I would say about that.
All right. Thank you for that reminder, Ms. Thrower. Is there any public comment on this item? Okay. Seeing none, we will move into meeting reminders. A school board meeting is scheduled for June 9th, 2026 at 5:30 p.m. and the next administrative briefing and work session is scheduled for June 18th at 9 a.m. And we'll move into board comments. Dr. Brewer?
I don't have anything else, thank you. We've had
Okay.
a great morning with good information.
Yes, lots of good information. Attorney Powers?
Just wanted to inform the board of a outcome on the Marion County Board of County Commission vote as to the special use permit. In a 4-0 vote, the Marion County Board of County Commissioners denied the special use permit for food waste processing and composting near Pheasant Elementary. That was done yesterday, so just wanted to update the board. And that's all that I have.
All right, thank you. Board Member Thrower?
Thank you. Gosh, we could probably sit here the rest of the afternoon and talk about all the things that have happened since the last time we were together, especially, of course, our graduations are top of mind, and there was a lot of moving parts and worries about the weather and everything else, but as usual, everyone came together and we got it done in pretty good style, I would say, and very safe style. So I'd like to thank the community for their, willingness to work it through, with us and sharing the concerns that they had. Well, if we did this, what about that? And we're going to always continue to try to improve, and I know there'll probably be some already serious debriefing going on and what could be done, differently. So I look forward to more conversation about that. We have the Florida School Boards Association Summer Conference coming up next week, and it's very historic for Marion County Public Schools and our school board to have our first president-elect being board member, second one down from my left, Dr. Campbell, who will be sworn in as the next president of the Florida School Boards Association, and they represent 67 counties. So that's a pretty big deal, and it will be my pleasure to introduce her to that esteemed body next week.
Good. All right.
I'll keep it at that for today.
Thank you, Ms. Thrower. Reverend Cummings.
Yes, and again, congratulations to Dr. Campbell, because she will be our FSBA president come this time next week. This time next week she'll be in the seat, so congratulations to her, and we look forward to a very informative FSBA meeting, summer conference next week. Very good meeting this morning, very informative, a lot of great information. I do want to tackle something that may be uncomfortable, may just may tick some folk off, but it'll be all right. I shared with the superintendent on yesterday some concerns with something. We heard in the superintendent's initial report this morning that there were 31,000 people that came through graduation, not counting students, not counting staff, 31,000 folk that came through graduation, and it was a very successful graduation for the whole county. I received a screenshot or something from someone about board members and how board members were at the graduations and their perceptions of what board members do when we're at graduation, and are we paying attention, or are we just there? Let me say this, and I'm speaking as this board member, but I'm speaking based on the people that I work with, my colleagues who are board members. Every one of us truly were excited about what we saw and how these young people were graduating and the families. Our priorities are always going to be about doing the right thing, and our priorities are always going to be about safety. Safety one, and then making sure that this once-in-a-lifetime event for these students is that memorable, that is going to be something they're going to cherish forever. The comment I saw was about board members being on their phone. Well, I was one of those board members that was on the phone, and I like the comment that board member Conrad gave in the social media post that said, thank you for extending grace. Number one, let me say this. Just because we were on the phone doesn't mean that we were on the phone doing social things. I think all of us had concerns about audio, about safety, and we were addressing those things on the fly. I definitely can say that we addressed the audio. We had people in the audience that was texting us during the actual ceremony saying, we can't hear. There's safety issues. So just because you see us doing something doesn't mean, some of us don't know how to use our Apple Watch and speak to our Apple Watch and do it effectively. So some of us are going to text it, but I can assure you that every board member that was there at all the graduation, there was one of us at least every graduation. There wasn't a graduation that we were not there. We were there. And that's something big that some counties, board members don't even go to the graduations at all. But we were blessed to have our board members there. So it's our intent that we make sure that it's a memorable experience for these students, for the parents. Parents are saying, I can't hear my kid's name. They got cow horns or bull horns, whatever those things were, and we are there to make sure that it goes forth. I want to thank our staff because of what they did to make sure that it was a memorable event. When there was an issue and we text someone, and said, hey, there's an issue, they jumped on it right immediately. If there was people standing up in front of folk and families could not see their kid walk across, and we text someone and they quickly addressed it, that's why those things were happening. It wasn't just something out the sky happened. It was because we were texting folk. So I do, again, I like Ms. Conrad's response. Thank you for the grace for those that understood that we were there. We were also still there in our official capacity, but we were working at the same time. We were still working at the same time. I thank all of our volunteer staff members that came out of their own personal space and time to come and make sure that we got people processed in and out, and there was no incidents. There were no incidents that I heard of where we had people jumping out the arena into the stands. I didn't hear any of that this year. I didn't see any of that this year. As a board, we felt comfortable being in those spaces, and so I want to thank the public that understands our job and understands what we do in those spaces. I heard every speech, every salutatorian or valedictorian, whatever the speech was. I heard every principle, words of encouragement. We heard all of that, and I was proud to be a Marion County School Board member and to be able to be in that space and to celebrate with these young kids. I think sometimes folk look to critique everything that we do for whatever reason, but know that these 5 members that I work with on these other 4 board members that I work with on this board, truly were there for the right reasons and doing the right thing at the right time, in the right place. So I choose not to respond on social media like some of my board members will do, but there are sometimes you see those type of posts, and it just kind of irks you to know that people are thinking in a negative light, and I just call them mean people, mean girls, mean boys, whatever they are. But we were there for the students, and congratulations to the class of 2026. You guys did a great job, and to all of our staff and to our community members. Let me say that too, because when we needed to pivot because of inclement weather, we had folk that were willing to step up to the plate immediately and make sure that we pivoted. And because they pivoted, we didn't have the wet mortarboards and the droopies. We didn't get soaked. It was because of a community such as Marion County and people that was willing to step up to the plate and make sure that we knocked it out the park. And I want to say this, we knocked it out the park. From the live streaming, those that were able to live stream, we knocked it out the park. So congratulations again to the class of 2026.
Thank you, Reverend Cummings. Dr. Campbell.
Thank you. I wasn't going to touch quite on all that you did on graduation. It was a great experience in so many ways, and I believe even more, I said this to one of our area superintendents, and I'm not going to open a can of worms to say if we were able to do all of them at World Equestrian Center in the indoor expo center, it would save a lot from the inclement weather conversations that we continue to have and struggle with. I'm not going to go there because I know that'll be a conversation for another day, but I do believe as our strategic plan now has the focus of a portrait of a graduate, this next 5 years of this strategic plan, every employee, in my opinion, should be focused on graduation. And I'm talking about high school graduation. It was a very intentional thought process of our previous superintendent that we not actually call our other celebrations of the other grade levels, VPK graduation, elementary graduation, middle school graduation, though I know that that's a touchy subject. If we're really focused on the portrait of a graduate, it's that high school senior who's completed everything for the superintendent to say, you may now turn your tassels. And that is the culmination that we need to be seeking after. And so, again, conversations for another day. Not trying to open up that can of worms right now, because I know that will add some angst to some of our communities that have been so used to holding their graduation celebrations at all different levels. But as every employee focuses on that high school senior graduation, then we as a board and as a district need to make sure that that graduation is all that it can be. And this year, it really felt like we had done a good job. I'm surprised. Are air horns not metal? Like, how?
I was surprised that too, how?
I'm like, why we even had air horns, I'll never imagine. The other thing I know, as you guys are debriefing, these enormous balloon displays, I appreciate families being so excited and wanting to provide those to their graduate immediately upon graduation. But they are sight disruptors to everyone else in the arenas and auditoriums. So how we handle that in the future, I understand they're not metal, but how we handle that in the future, I think, can be considered and obviously told to families in advance, just like we told them not to bring their umbrellas and not to bring their big bags and all, like, if we choose to go that route. But graduation on the whole, thank you to 31,000 people who, I'll use a phrase of Reverend Cummings, thought it not robbery to consider our graduations an important place where they needed to be. And so it says a lot that our community values it that way, and I'm grateful that 31,000 people chose to celebrate with our kids because they deserved it. Okay, moving on. At the Fessenden graduation, the Fessenden Forever Scholarship was rolled out, and so needing to give, it's already been said, but another special thank you to the St. Bernard Foundation and Bernie Little and his wife for that. And if you did not see it and you happen to be seeing this, knowing that every one of those Fessenden students now has an opportunity to receive $4,000 scholarships just simply by being a Fessenden student. Forever. And it is in perpetuity. The endowment has been set up and established, and that is starting with the class of 2026, and then the fifth graders obviously got the announcement when they were there, but the 2026 Fessenden students that were graduating from our high schools also received it. So nothing like that's ever been done in our school district, and I know it's been seen elsewhere, but we now have something that we can hang our hat on thanks to Bernie Little and the St. Bernard Foundation. So thank you again, and doesn't mean it has to be the only school that has something like that. Again, capital campaigns, resources are not a problem among certain people in our community, and endowments can be set up with estate planning gifts and all kinds of things. So let your legacy live on if you choose to have that happen. Mr. Avery already left, but I did want to say thank you to him for being here. As the member of the insurance committee on the school board, I did talk to Dr. Brewer about, it does feel a little, I don't want to say backwards, but we haven't had an insurance committee meeting in more than a year. And so I'm looking forward to that group being able to really analyze and delve into all of the options that were presented today. So, and I also wanted to speak to how he mentioned the assured excellence isn't the only option. And he is right, there are plenty of other options like that, but assured excellence is a Gallagher product. And so since Gallagher is our insurance company of record of sorts, I believe that that would be the only one we'd be able to use through them unless we were sending that out for bid or something like that. So anyway, I think that wraps up pretty much of what I had to say. I'm looking forward to being with you all at the Florida School Boards Association conference, June conference next week. Obviously, it is our shorter conference. It's only like a day and a half, and so there are committee meetings all day on Wednesday, and because of that and my commitments on Wednesday morning, board, I'm going to be virtually participating. I'm telling Mr. Christian and all of you now, I'll participate in Tuesday evening's board meeting telephonically, just because of my Wednesday morning commitments. I think it'll be important for me to be down in Tampa already on Tuesday evening for that meeting. So With that, I think that concludes my comments. Thank you, Vice Chair Conrad, for chairing our meeting today. So great.
Yes, thank you, Dr. Campbell. And I will be quick because when you go last, almost everything gets covered before it gets to your turn. I do have 2 reminders. Board, we have a tour of South Marion High School on Monday at 10. And then I did have Thursday FSBA swearing in for Dr. Campbell, and then that is correct at 10:30?
Yes, ma'am.
Is the time certain? Okay, so I did want to remind the board of those 2 things, but nobody has forgotten, so that's great. I too wanted to give a shout out for graduation and safe schools. In the last several meetings where we've talked about graduation, I had considerable concerns about safety, and I just want to say, Corey's in the audience here, and for our SROs and Safe Schools Department, I felt completely safe at every single graduation. So all the concerns, and I had several, were addressed. And so thank you to the work of the team and for our district staff and all of the volunteers, because it is a wonderful experience, but it is hot and it is long. So it's a lot of energy expelled during all of those 8 graduations. So thank you again for your commitment to the safety of everybody that participates in graduation. I know that's a lot of work. I wanted to say yesterday I participated in the Value Adjustment Board. We only have that meeting twice a year, and so in preparation, I was Googling and looking at value adjustment boards around the state. And so, I was like, this could be exciting, but it was not. And the county commission did a great job. We were in and out. It was very well organized. We had some updating information about who can serve and when they can serve, and I shared that with Ms. Martinez-Young. So we are good to go, at least right now, for another year. That was ended up being a fun experience. And I, too, wanted to address Mr. Avery, who was here. He went out while you were speaking, Doctor, right at the beginning of you speaking. And I just wanted to clarify that this board, and I believe the district staff, we pride ourselves on being transparent. And so I'll just say, as sitting as chair today, that we want to make that right. We want to get this process back the way it's always been done so that everyone is comfortable. There are a lot of hard conversations that we have to have. If you're watching the news, or you're reading any newspapers, or you're on social media, you know that those challenges are coming forward. And so we want to be proactive and get ahead of the game, and so we welcome you to the table to problem solve. And that is all I have. Dr. Brewer, I checked with you. You're good. All right, you're good. All right. With that being said, if there's no further business, we will adjourn this work session at 11:45. Thank you very much, Board.